Buenas
Good
tardes.
morning, good afternoon, good evening. I extend a warm welcome to all the people who are joining us in the webinar number 156, organized by the Andean Health Organization Hipólito Unanue Agreement. This cycle of webinars began in May 2020, and in this new year, 2023, we will continue to share the spaces of interlearning with the best information available and, as always, based on evidence. As a reference in health in the region, we continue uninterruptedly the joint and coordinated actions with the 6 member countries, Bolivia, Colombia, Chile, Ecuador, Peru, Venezuela, thus fulfilling the goals and objectives to strengthen the health of our people. As a reference in health, we highlight a message for the critical epidemiological situation in the region. Faced with this tridemic, the epidemic by influenza, COVID-19, and RSV viruses, it is recommended to intensify vaccination campaign. Remember that the protection of the vaccine against COVID-19 is renewed with booster doses, and that the priority age group due to the great vulnerability are the elderly. Therefore, it is essential to complete our vaccination schedules. It is also important to maintain care measures such as the use of masks, hand washing, and isolation of people with respiratory conditions. Remember that in places where there is a higher concentration of people, the risk of contracting COVID-19 increases, and therefore ventilate the spaces, use masks all the time. They remain in closed spaces. It is important to remember that vaccines against COVID-19 are available for the elderly, adults, youth, children, and adolescents. Protect our family against COVID-19. We highlight, finally, as an organization, the importance of solidarity and respect for people. In accordance with what has been said, today, Thursday, January 19, we open our virtual doors to discuss a topic of great importance for our region with this webinar. This is the update on the COVID-19 pandemic. We invite you to leave your name, organization, and country from which you are joining us through the comment box in the Facebook Live or YouTube Live chat. In that same space, you can leave your questions or send them via email to webinarhorasconju@gmail.com. To access the certificate of attendance to this webinar, as usual, you must fill out a short survey and leave your data in the fixed link found in the Facebook Live or YouTube Live chats. The certificate will be sent to your email in the next few days. This webinar will be developed with the usual dynamics. We will start with the institutional greeting, then the dissertations of our speakers, the active pause, and the space for Q&A. To begin this important day, I give the floor to Dr. Maria del Carmen Calle, Executive Secretary of Horas Conju, who will give the welcome and institutional greeting. Thank you very much, Marisela. Well, good morning, good afternoon, good evening. Welcome to our first webinar of 2023. We're talking about webinar number 156 of the Andean Health Organization that started these webinars and with this continuous interlearning in May of 2020. From the Andean Health Organization Hipólito Unanue Agreement, we consider that important that our first webinar in this year deals with the COVID-19 pandemic.
esperanzas que en el
We have hopes that
2023
in
ya
2023
se hable del
we
final de la
will talk
pandemia.
about the end of the pandemic.
El Horas CONU, a
The Horas
través de
CONU,
su
through
trabajo
its
ininterrumpido,
uninterrupted
como
effort
referente en
and
salud,
work as a
junto con los
reference in
ministerios de
health,
salud de
together with the
Bolivia,
ministries of health of
Colombia,
Bolivia, Colombia,
Ecuador, Perú y
Chile,
Venezuela,
Ecuador, Peru, and
realiza
Venezuela,
reuniones
holds
mensuales
monthly
con las
meetings
autoridades
with the health
competentes,
authorities
donde se fomentan
where
espacios de
cooperation
cooperación
spaces are
y de
promoted
abordaje
to
de la
address
pandemia
the
en materia
pandemic in our
gubernamental,
Andean
y
region.
no solamente de la
And not
pandemia.
only in
También
the
tocamos otros
pandemic, we
temas
also
que son
talk,
sumamente importantes.
deal with other important topics.
Este año vamos a
This
continuar
year,
con estas
we will
reuniones
continue with these
con el
meetings
objetivo de
with
fomentar
the objective of
un
promoting
clima de
decisions based on
evidencia
scientific
científica
evidence
que contribuya a
that
la
will
prevención
allow
de la
us to
pandemia.
contribute to put an end to the
También
pandemic.
hablar
And we
del
also
COVID, ¿no?
talk about the long COVID,
Todo lo que está quedando después del
everything
COVID.
that is left after the
Desde el
pandemic.
Organismo Andino de Salud
From the Andean Health
también
Organization, Hipólito
apoyamos las
agreement will support
recomendaciones
the
brindadas por la
recommendations provided
Organización
by
Mundial
the
de la
World
Salud
Health Organization
sobre lo que puedan
on
hacer
what governments
los
can do
gobiernos frente a la
in the current
situación de
situation
pandemia
of
por
the COVID-19
COVID-19.
pandemic.
Primero,
First,
impulsar la
promote
vigilancia
epidemiological
epidemiológica.
surveillance.
Esto implica
This implies
identificar de
continuing to
manera
intensively
intempestiva
identify
casos de
COVID-19
COVID-19
cases
a través de pruebas
through
masivas
molecular tests
que
that
permitan el
allow genomic
secuenciamiento del
sequencing.
genoma. Dos,
Second,
vacunación. Es
vaccination. It is
indispensable
essential to
priorizar los programas de
intensify
vacunación,
vaccination programs,
priorizando a aquellos
prioritizing
cuya
those
primera
whose
dosis
last dose
fue
was
administrada
received
hace varios
several
meses
months
y
ago
aquellas
and
personas
those
que
who
aún
have
no
not
han
yet
recibido o
received
no han
or have not
completado
completed
sus esquemas de
their
vacunación.
vaccination schedules.
Tres, el cuidado
Third,
clínico,
clinical care.
contar con
To
esquemas
have
adecuados de
adequate treatment schedule
tratamiento para los
for
pacientes
patients
afectados por
affected by
COVID-19.
COVID-19.
Y por último, y no
Finally,
menos importante,
last but not least,
comunicar de manera
communicate
efectiva
effectively
sobre la situación
about
de
the
la COVID-19
COVID-19
a la
situation to
población.
the population
De esta forma, todas y
so
todos
that
nos
we can
involucramos
all
como
become
parte de
involved
la
as
solución
part of
del
the
problema.
solution to the
Entonces
problem.
estamos hablando de
So we are talking
vigilancia
about surveillance,
epidemiológica,
epidemiological surveillance,
vacunación,
vaccination,
cuidado clínico y
clinical care,
comunicación.
and
La
communication.
pandemia por
The
COVID-19
COVID-19
aún no ha
pandemic is not
terminado.
over yet.
Por ello, en esta
So
oportunidad
this time
contaremos
we
con
will
los
have two
excelentes
excellent
profesionales del Organismo
professionals
Andino
from the
Convencional
Andean Health Organization,
que nos
Hipólito
brindarán
agreement, who
información
will present
sobre la
information
situación
on the
epidemiológica
current
actual en
epidemiological
Bolivia
situation
y
in
en
the
el
Andean
mundo,
region and the
así
world,
como nos hablarán de las
as well as
nuevas
talk about the
variantes
new
y la
variants and the
importancia de la
importance of
vacunación.
vaccination.
Bienvenido, doctor Luis Bengolea,
Welcome,
y
Dr. Luis
doctora
Bengolea.
Patricia
Welcome,
Jiménez.
Dr. Patricia
Bienvenidos y
Jimenez.
bienvenidas participantes
Welcome
a
to
este
all
nuestro
the
webinar
participants
número
of this,
156,
our webinar number
actualización
156,
sobre situación de
update
la
on the
pandemia por
COVID-19
COVID-19.
pandemic, situation of the COVID-19 pandemic.
Gracias. Luego del saludo
Thank you.
institucional de
After
nuestra
the
secretaria general,
institutional greeting from our
atiendo
secretary, I
de
introduce
manera
myself.
brevísima
My name is
las
Maristela Malki. I'm the
características del
Deputy
webinar.
Secretary of Auras
Tengo el
Conyo,
agrado moderar
and I am
este
pleased to
primer
moderate
webinar de
this
este
first
presente semestre.
webinar of the year.
Tras este preámbulo, vamos a dar
After
inicio a
this
este importante
preamble,
evento,
we will start this
dando la más
important
cordial
event,
bienvenida a la
welcoming
doctora Patricia
Dr.
Jiménez López.
Patricia Jimenez
Ella
Lopez.
es médica de profesión,
She's a medical doctor
con especialidad en
with a second degree in microbiology.
epidemiología y
Has a
bioseguridad
master's degree in virology and
Tiene
biosecurity.
experiencia como
He
docente
has
e
experience
investigadora en la Escuela
as a
Nacional
teacher
de
and
Salud
researcher at the
en
National
Cuba
School of Public Health
y en
in
el
Cuba
Instituto de Medicina
and in
Tropical
the
Pedro Curie.
Pedro Curie Institute of Tropical Medicine.
Es diplomada en gestión de
He has a
proyectos
diploma in
internacionales
management of
internacionales,
international cooperation projects,
colaboradora de la Red Brasileña
collaborator
de
of the Brazilian
Cooperación
Network
en
of
Emergencias
Cooperation in
y del Foro
Emergencies
Social
and
Mundial
the World
para la
Social
Seguridad Social.
Forum on Health and Social Security.
Cuenta con experiencia en proyectos
She has experience in global fund projects in the three components, HIV, tuberculosis, and malaria. She's currently the coordinator of monitoring and evaluation of the program for the strengthening of laboratory diagnosis of tuberculosis in the Americas region of the Andean Health Organization Hipólito Unanue Agreement. Welcome, dear Dr. Jimenez. You have the space, you have the floor. Good morning. Can you see the slides? Can you please? Thank you. Yes. Good morning, and thank you very much for this opportunity of sharing some ideas about how are we doing with the COVID-19 pandemic, what are the scenarios proposed by this virus according to its characteristics, and how much have we made progress as a response from science. Years ago, humankind started receiving an important volume of information about SARS-CoV-2. I know people that were not trained in health areas that now can differentiate the virus from the bacteria, or as we say, the viruses are smaller and there's hardly any treatment, just some antivirals, as opposed to bacteria that are larger and can be killed with antibiotics. And also talk about antibody tests, antigen tests, PCR, and they understand that there are some differences in what each one detects. So I think that this is the result of processing so much information and a lot of explanation of what we were learning about this virus, and also of the interest of the people themselves, because we all need to know what is going to happen with our health and when can we go back to our rather normal life, although not exactly to that normality that we had before the pandemic. That is why today I feel comfortable to share with this diverse audience that through a simple language, we can understand what are the SARS-CoV-2 variants that are circulating at present, why those mutations occur, and what are the challenges that we have ahead with this virus. And more than going into technical reasons and concepts, the purpose of the presentation is that we stay with three ideas that will put us in the current scenario and prepare us for possible future scenarios, because this virus has not told this complete story yet. Those three ideas that I would like you to consider: first, that SARS-CoV-2 mutates to new variants during transmission. Number two, COVID-19 vaccines protect from severe forms for at least 6 months. And number three, monitoring new variants is key to adapting diagnostic tests and vaccines. A basic concept that we will start is that every organism capable of reproduction has a genetic code. Inside a virus, inside a bacteria, inside a cell, or a cell of a plant, of an animal, or a fungus, or a protozoan, in any way of life that can be reproduced, there is a common element, which is a nucleic acid that is like a code that is written with only 4 characters in different combinations, that is like a necklace of several beads. And that code contains the orders, say it some way, of what's going to be manufactured. So when that recipe is organized, the body can reproduce and obtain a copy of itself. That code in our cells, humans, is the sequence that we have in our DNA that is copied and transcribed to RNA and then be translated into protein. Well, there's some virus such as the SARS-CoV-2 that come with the RNA, messenger RNA, and there is the sequence of all that has need to be produced so the virus can generate copies of itself. This is the virus or a scheme of its structure. The sequence is inside here. This is the RNA as a necklace made up at about 30,000 beads, very well ordered, that should not change because when those sequences are translated, they're going to produce all the parts that make up a copy of this virus. Every 3 beats of that necklace, that is not beats, they're called nucleotides. Let's continue talking about in terms of beats. Every 3 beats of that necklace, which is the RNA, it defines what amino acid will create another chain, but in this case, it's a protein chain. So one protein is a chain of amino acids. So 3 beats of the RNA will tell what amino acid will be part of that chain that will become the protein. For example, if 3 beats like this one, say AUG, the amino acid, it will be methionine. If 3 beats say ACG, the amino acid will be threonine, and so on. You start forming the protein chain with the amino acid according to the order provided by this triplet of bits from the messenger RNA. This wheel that you see here to the left of the slide, where I can read the triplet from inside to outside, and then I know what is the amino acid that corresponds to that triplet. There are nucleotide changes that do not affect the amino acid when it's translated. For example, if I start from the middle and say GAA, that's going to be translated to this amino acid called glutamate. And if I say GAG, the same, it will translate the same amino acid. On the other hand, there are nucleotide changes that disrupt the result because they yield another protein. For example, GAA translates to glutamate by GCA. Indeed, they only change one letter, is translated to alanine. It is normal and common to see the occurrence of mutations, of deletions, and other changes in the sequence of nucleotides. For the case of the virus, the more bases of one Wi-Fi where it replicates to another one, higher chance to mutate. And most of the times, fortunately, the mutations don't have implications in the properties of the virus, but some other times these mutations do, they are established and they confer a sort of new attributes to this virus. The amino acids that we see here in this list may be represented with 3 letters. And this, what we see here below the table with down here with the amino acid names are the variants of SARS-CoV-2. And these numbers that we see up here, K470, L452, refer to the amino acid that should go on that position, the link of that chain that makes up the protein. So in the protein chain, in position 417, the link that we should have is the amino acid K, which is lysine. In position 452, we should have leucine. In position 478, we should have threonine. In 484, glutamate. In 501, asparagine. And why I said it should be there? Because that's the way they were in the original variant from Wuhan. What happened was that the alpha variant was stabilized with this change in position 501, and it's no longer asparagine, but in this case it's tyrosine. In the beta variant is characterized by these changes. These amino acids were substituted by others. In the gamma variant, these are the substitutions, and the delta, these other three. And all these changes in the amino acid sequence are the result of mutations in nucleotides. So in some bits of this RNA necklace, that is going to later on manifest as changes in the amino acids in the sequence of the protein chain. And those amino acids, when they are changed, they can modify certain properties of the protein that they make part of. And in this case, the changes affect a famous spike protein that we have heard so much, which is the one that the virus used to enter our cell. If the change is favorable for the virus could acquire a series of attributes that will facilitate their transmission or shorten the time of replication or provide more virulence, or that we cannot detect it with the test design to detect it because there wouldn't be an adequate matching or can evade the antibodies created against it or the response to drugs that we have tested. So here we have, for example, changes in the spike protein. This is part of the spike protein with changes with different colors between the Delta and the Omicron variant. And as you can see, there's a major difference in the number of mutations accumulated by the Omicron variant with respect to the previous one. When that happens, we can be facing a variant of concern. When these changes start to stabilize and we start to see that we start with a variant of interest to which we look under the microscope, and then we define the character of being a variant of concern. And to be a variant of concern, it needs to fulfill at least one of these characteristics: increased transmissibility or detrimental change on the COVID-19 epidemiology, or increased virulence, so more aggressive virus, or the change the clinical presentation of the disease, or that we demonstrate that the social and public health measures or diagnostic tools, vaccines, and treatment decrease the effectiveness against the circulating virus. Up to this moment, we had 5 variants of concern after the original from Wuhan, and these variants, once they emerge, they increase their circulation, they become predominant and displace previous variant from the end of 2021, where the Omicron variant was identified. It has been occupying the largest distribution and is predominantly with us with the subvariants or lineage or side lineage of Omicron. The change in amino acid in position 501 of asparagine, which should be in the origin for tyrosine, is associated to greater tyrosine. The change in 484 lysine instead of glutamate is associated to the escape to neutralizing antibodies, and recent studies have alerted about the importance of changes that are being observed in sublineages of PA4, like what we see in the 346 position, where arginine exchange for threonine in position 358, exchange asparagine for serine, and all of this associated with the antibody evasion. This graph shows how the different lineages and sublineages of the Omicron variant are being displaced among them and become predominant very quickly and dynamically. This is the situation and the distribution in June of last year in Colombia, just to give you an example. And this is how we start January of 2023. To the right, we have a diagram this tree of Omicron lineages and sublineages. Several studies, recent studies, such as this one that I placed in the right, that was posted on September 6th of 2022 by a team of researchers from Taiwan and the US, indicates that the subvariant BA46 and BA47 and BA59 are expanding, and they have the mutation in residue 346 associated to antibody evasion. That research team compares several things: the affinity of virus to join our cells through the receptor they use or binds to the cells, and compare these variants with regards to BA5. And they also did neutralizing study using serum of people who received 3 doses of vaccines and of people that were infected on a natural way with BA1 or BA2 variant, and also compare it to a panel of 23 monoclonal antibodies. And what they found was that the affinity for the receptor binding to enter the cell was similar for all the subvariants analyzed, but the antibody evasion was significantly greater in the subvariant that had this mutation. In fact, the study alerts that as long as the virus continues evolving, our monoclonal antibodies arsenal that are authorized could be uh, depleted, and that puts many people at risk, those who have some type of immunosuppression, for which we are using this type of passive immunization. And this other publication to the left of December 9, and that is of a research team from Sweden, points out that although the vaccines and infections by SARS-CoV-2 have given, as a result, a high level of individuals with positive antibodies, the SARS-CoV-2 Omicron variants continue to propagate even with high rates of infections in individuals vaccinated with 3 doses. And from the emergence of Omicron at the end of 2021, the speed to which they have seen new variants shows a greater capacity of immune escape of these subvariants, and that sequencing data that they were able to perform with 30 samples from more than 1,700 participants revealed that these Omicron subvariants are producing phenotypes that are shared between them. And these researchers consider that this states a possible change in the landscape of transmission, so that instead of being dominated by specific sublineage, what we're going to see several different subvariants, but with a specific phenotype, can together create a dominant group. And it also points out that one of these important mutations is the position 346, located in the domain of the receptor, the spike protein, as a way to escape in neutralizing antibodies. As I mentioned, of the 30 samples that they were able to sequence, all were distributed between 13 sublineages, and in 6 of those sublineages, we have the mutation of 346 residue. I have mentioned the neutralizing studies. I would like to mention in a very simple way what they consist of. A cell culture, like a fabric in the bottom of this barrel, and cells that have a receptor. In that cell culture, we place the virus taken from a respiratory sample. The virus is going to grow in that cell culture, like, and it's going to multiply, replicate, and going to provoke damage. Serum of a person that is vaccinated or a person that's recovering from the COVID-19 infection should stop that damage that the virus produces, because the serum is going to neutralize the virus. That is what we expect. If that doesn't happen and the cell culture continues to be damaged, it's because the virus is not being neutralized by the antibodies in the serum, and in that case, it is an escape variant to the neutralizing antibodies, and therefore the neutralization studies are extremely important. The strategy from the evolution of the virus is that we allow them to continue to exist. The virus is going to be successful to the extent that we humans let them circulate. The virus says, I have to replicate, replicate, and replicate, not to cease to exist, always have susceptible guests. And the people, what should we do? Well, we should prevent transmission. And it's been demonstrated that it's very difficult to sustain these preventive measures or pharmacologic measures that will prevent the virus to go from one person to the other. The SARS-CoV-2 virus has been completely sequenced. We know the structure of the virus. And this makes that we are able to construct, build the sequence because we know the order of those beats in this necklace, and we know what proteins are expressed. We know the beats and we know the links in the protein chain. And to build the part of the virus, those genetic sequence portions are important to create the diagnostic test that need to have sequence that make that perfect match with that of the virus and can be amplified, and to manufacture vaccines that include those mutations, changes that we detect. If of everything that makes up the virus, we know which bits are understood by our immune system as foreign, we can present those bits to the immune system so to prepare. The immune system creates a specific response to defend against foreign elements, and also leaves populations of lymphocytes, of cells of the immune system ready to recognize and activate quickly in the future when faced with the same foreign element. This is what we call immunologic memory, and that concept is the basis of the creation of vaccines. And foreign is everything that does not coexist in harmony with our body, including a virus, which we don't recognize as our own. That foreign element that we can call antigen, usually the result of the genetic sequence was expressed. We mentioned that the genetic code dictates what's going to be produced. Well, that antigen is going to be generated by that sequence, and I can have it, this antigen. If I take it all together with the other elements, I can take the virus, complete virus, and I can also have it, I can have it also alone, isolated. I can extract it from the virus and stay with that little portion that my immune system is going to recognize as foreign, and we can synthesize this in the laboratory, and also we can take the genetic sequence that codes it so that my own body can produce that, because my body will have the code. Many elements of the SARS-CoV-2 structure are recognized as foreign by our immune system. And this virus is made up by protein, lipids, sugars, and the nucleic acid inside. But the proteins have bits of this chain that are the target, so the immune system can recognize and neutralize the virus. Those little portions of proteins are the antigens, and in them, there's specific recognition sites by our antibodies and our defense cells. So all the proteins of the virus induce our immune system to respond in SARS-CoV-2. The most antigenic proteins that look more foreign to our immune system are the spike protein and the N protein. And against S protein or spike protein is where our antibodies are directed. So if we know what small portion of the protein have greater antigen power and are going to provoke a better immune response, we can inoculate our body with those antigens or the sequence that code for that antigen. So that then the vaccines make that the antigens enter into our body without us developing the disease, because in no case we are administering the virus with the capacity of provoking harm and reproduce. We have many variants that contain that way that the antigen enters into our body. That is the essence of the vaccines. Either we have the complete virus, such as these ones, or we have a protein subunit, a little piece of that protein, or we have a small portion of the sequence that codes for that antigen, and this is a case of mRNA vaccines, either in a particle or a viral vector. In any case, what enters into our body is an antigen that's already or is going to be generated inside us, so our immune system can respond. What question could we ask ourselves? If the sequence of the S protein changes in what we were commenting, that we could see mutations in change of one amino acid for the other, is the vaccine going to work? And if the mutation that's generated does not affect the immunogenicity of the vaccine antigen of waking up our immune system, the antigen continues provoking an effective immune response, the vaccine continues to provide protection against a new variant. That is why care should always be taken to ensure that the new variants are neutralized by the antibodies generated by the vaccine. Remember the small battle with the cells that the virus shouldn't produce any destruction. If we add the serum of an immunized person, that serum should neutralize unless we have an escape variant to those antibodies. That is important to do sequencing and do neutralization studies, and genomic surveillance is so important. We also do epidemiological surveillance and clinical surveillance and everything that would allow us to detect changes in the behavior of the virus. I would like to finish by repeating the statements I did at the beginning, and now with the hope that we're talking about variants, it's not weird. We can all feel and see what's going on. SARS-CoV-2 mutates to new variants during transmission. And I highlight the word transmission because from our behavior as a society, the virus will transmit or not. Non-pharmacological preventive measures continue to be the most powerful weapon to stop this virus. To avoid that in the transmission from one human to another will mutate to more challenging forms, use masks in closed spaces, ventilation, hand washing, isolate if you have respiratory symptoms. All of this prevents transmission. Vaccines don't prevent transmission. COVID-19 vaccines protect us from developing severe form for at least 6 months. So it's not just to know that these persons are vaccinated or not, of how long have passed since the last dose received, and to monitor for new variants from the epidemiological and clinical point of view, but also through sequencing and neutralization study. This is a genomic surveillance. This is key to adapt diagnostic tests so that they can include new sequences and the vaccines that will add the new variants and subvariants like we see in the bivalent variants prepared with RNA messenger technology that are adapted to the circulating variants. I will thank you once again and be ready to answer any question after the next presentation, where we're going to see how the different variants and subvariants of SARS-CoV-2 are distributed throughout the world. Thank you very much.
Muchas gracias.
Thank you,
Excelente y
Patricia.
divertida
Excellent
intervención,
presentation,
Patricia.
Patricia.
Nos ha hablado
And
sobre
just
las
talking about the new
dos
SARS-CoV-2 variants and the implications for public health.
Creo que nos quedamos
And I think
con las
that
conclusiones que nos
we
mencionaba del
will
SARS-CoV-2.
follow that conclusion. You mentioned that SARS-CoV-2 mutates during transmission,
Cuanto más
and
pases hace, tiene
the
mayor
more
probabilidad
transmission,
y
the
de
higher chance of
entre los
mutation
efectos que pueden incidir
and gain new
en la
attributes that
gravedad de
can
la
affect the
vacuna o
severity
las
and the
vacunas
evasion
o
to
el acceso
vaccines
al tratamiento.
or treatment.
Es importante
It
recordar
is
que las
important to
vacunas
remember that
protegen
vaccines
de las formas graves de
protect of
aproximadamente
severe
6
forms for
meses.
approximately 6 months.
Importante y
It
valorar
is
la
important to
acción
value
de las personas. Por
the
eso creo que es importante
people
reiterar
actions, so it's important to
que para impedir
insist
la transmisión
that
tenemos
in order to prevent
que
transmission,
aplicar las medidas
we need
de
to apply
distanciación
the
social, el
non-pharmacological
uso de
measures,
mascarillas,
the
el
use of
evento de
masks,
espacios cerrados,
ventilation of the closed
para
spaces,
un poco detener esa
in order to
transmisión y
stop
tener una
that
posibilidad
transmission and
de
reduce the chance that this
reducir
virus
las
can
dosis de
mutate and
medicación
generate variants
de
of
farmacéuticos de
concern
efectividad
that
y
may increase
evaluar
transmissibility
la eficacia de estrategias
or
comerciales
virulence.
de salud pública que puedan tomarse, ¿no? Reiteramos el
Once
agradecimiento
again,
por la
thank you very
presencia
much,
y el
Dr.
compromiso de todos.
Patricia.
Por favor, le pedimos que nos siga acompañando
And please stay in the room for
en el
the
espacio de preguntas
Q&A
que será después de la
space
presentación
after the
del doctor
presentation of
Luis
Dr.
Bengolea,
Luis Bengolea,
a quien invitamos
to,
ahora
to whom we invite. Dr. Bengolea is
de la
a
Universidad
medical
Nacional Mayor de
doctor
San Marcos,
at the Universidad San
tiene un
Marcos
posgrado
with
en el
a
programa de
postgraduate
Entrenamiento en
training
Epidemiología de Campo,
in
desarrollado en el programa de
field
Administración de
microbiology
Posgrado de la Universidad Peruana
at
Cayetano
the
Heredia.
Universidad Peruana
Ha
Cayetano
sido
Heredia.
consultor en la
He
Organización
is a
Panamericana de la
consultant for the
Salud
Pan
en
American Health
control y
Organization
respuesta de
in
brotes
surveillance
y
and
es
response to
secretario del
outbreaks
Ministerio de
and the
Salud de
representative of the
Perú,
Ministry of Health of Peru
miembro integrante del
as a
Grupo
member of
Intergubernamental
the intergovernmental group
para la revisión del
for
Reglamento
the
Sanitario
review of
Internacional
the
del 2003.
International Sanitary Regulation
Actualmente
2003-2004.
es el
He is
coordinador de
currently
Rabies
the
Andino Committee
coordinator of the Andean
en las
Committees on Border
presentaciones de
Health,
rabia,
Prevention and Control of
prevención y
Rabies,
control de
rabies,
enfermedades no
prevention and
transmisibles,
control of non-communicable
prevención y
diseases,
control de cáncer,
prevention and control of cancer.
vigilancia en salud pública
Also,
y
public health
vigilancia
surveillance
en
and
salud
national
pública
health
de
institutes
organismos
in the Andean Health
trilaterales,
Organization
convenio y politounana.
Political Agreement.
Bienvenido, doctor Bengolea.
Welcome, Dr. Bengolea. Go ahead with your presentation.
Muchas gracias.
Thank you.
En primer lugar,
In
quería
first place,
enviarles
I
un
would like
cordial
to
saludo a la
give
doctora
you
María
a
Elena
warm welcome to
Calle,
Dr. Maria del Carmen Calle,
secretaria
who is
ejecutiva
our
del Andean
Executive
Health
Secretary from the Andean
Organization,
Health
a usted,
Organization,
doctora
to
Marisela
you,
Malki,
Dr.
encargada
Marisela
de
Malki,
coordinar esta reunión,
who is
a todos
coordinating
los
this meeting,
compañeros del
to all
organismo que
my colleagues
están
from the
permitiendo llevar a cabo
organization
esta
who
reunión
are
virtual, y
organizing
a
this
la
virtual
maestra
meeting,
Patricia
and to
Jiménez, que nos dio
Patricia
una
Jimenez,
excelente
who
exposición
gave a brilliant
inicial.
presentation,
A todos los presentes,
to all the
un gran saludo y
audience,
espero
my
puedan
greetings, and hopefully
disfrutar de
you
esta
can enjoy
presentación y a la vez
this
también tomar
presentation and
conciencia
also
de
become
la
aware
magnitud de la
of
pandemia
the
y
magnitude
lo
of
que
the
tenemos que
pandemic
modificar
and what
para
we need
hacer
to
efectiva
modify
una respuesta
to have an effective
integral
response
al problema.
and a comprehensive response
Por
to this
favor,
issue.
Rob, ¿pudieras presentarme el
Rob,
primer
could you
reglamento?
please show the first slide?
La siguiente.
Next.
Lucho, no te escuchamos. Estás con el micrófono cerrado, por favor.
Bien, gracias.
Lucho, could you
Bien,
activate your microphone, please?
la
Well,
lámina anterior, estimado Rob.
the previous slide, please.
Sí, voy a presentarles los
I'm going
3 años
to
del inicio de la pandemia,
talk about 3
cómo
years
se
after the
vivió
start of the
esta,
pandemic,
los
what have
retos.
been and will be the
La
challenges,
pandemia de la
the
COVID-19
COVID-19
en
epidemic
China
in
en este
China,
momento está
that
teniendo
at this
un
moment
gran
is
impacto
having a
y
great impact,
preocupación a nivel
and
mundial para conocer la magnitud del proceso y la situación del
the
COVID-19
situation
a
of
nivel mundial
COVID-19 at
en
global
algunos
level
de los
and in
países
the
andinos.
Andean
La
countries.
siguiente lámina. El pasado mes de diciembre del
Last
año
December
2022
of
se cumplieron
2022,
3 años del inicio de la
we
pandemia
had
en
3
China
years after the
y
start of the
aún
pandemic,
tenemos las
and we
secuelas de
still
esta
have
gran
some
epidemia en el
sequelae
mundo
of this
entero.
major epidemic of the
La
modern world.
pandemia ocasionada por el
The
virus
pandemic
del
produced by the
SARS-CoV-2,
SARS-CoV-2
que
virus,
eventualmente
which
el mundo
eventually
entero conoció como
became known to the entire
COVID-19,
planet as
cambió
COVID-19,
radicalmente la vida en el
radically
mundo.
changed life in the world.
Sus afectaciones trajeron
Its
consigo
effects
una
brought
serie
us
de
a
cambios
series of
económicos
economic
y
and
sociales,
social changes,
temas que
and it
no
was
la
more
mayoría de las
than
naciones
noticeable
estuvieron
that not all
preparadas
nations
para
were
este
prepared
embate.
for this
Los
onslaught.
cambios en la sociedad
The
no se
changes in
realizaron a la fuerza
society
y la vida se
were not
modificó
long in coming, and
en
life
todos
was
los ámbitos.
modified all over the
El
planet.
transporte, el
Transportation,
turismo,
tourism,
el acceso a la salud,
access to health,
el incremento
a
en la cantidad
remarkable
de
increase
fallecidos,
in the number
los
of deaths,
sistemas de salud desbordados,
overflowing of health
las
system,
tensiones políticas y
increased political
sociales
and
en los
social
estados,
tensions,
la economía de las
the
naciones en
economy of
emergencia,
nations in
la
emergency,
parálisis
and the
industrial
industrial
en
paralysis
desiertas
in
fue
deserted cities were
la
the most
evidencia
important
de la
evidence
presencia
of
de
the
esta
presence
nueva enfermedad.
of this new disease.
A febrero del año
In
2021
February of
se
2021,
abrió la esperanza al
hope
mundo
was given to the
al
world
ponerse
with the
10 vacunas
availability of
aprobadas
10
para el
vaccines
uso
approved
en
for
emergencia
emergency
y
use,
actualmente se evidencian nuevos
and
cambios
new
en el
changes are now
comportamiento del
evident in
virus,
the behavior
pero
of the
también
virus,
en la
but
sociedad
also
resiliente
in the
que se
resilient
adapta
society
nuevamente a
that
la
is once
presencia
again adapting
del
to the
virus.
presence of the
Siguiente
virus.
lámina.
Next slide.
En diciembre del
In
año
December of
2019,
2019,
la provincia de Hubei,
the
en
Hubei
China,
province
se
in
convirtió
Wuhan,
en el
China,
centro
became the
de un brote de
epicenter
neumonía
of a pneumonia outbreak of unknown cases.
Un grupo de pacientes
A group of patients
presentó a
presented
diferentes
to
hospitales con
different hospitals
diagnóstico
with diagnosis of
de
pneumonia
etiología
of
no conocida.
unknown etiology.
La mayoría de estos pacientes fueron vinculados
Most of these patients were
al
epidemiologically linked to
supermercado
a wholesale market
Frigorífico y Animales
of
de
live and processed
procesado
fish, seafood,
de la
and
provincia
animals
de
in
Hubei.
Hubei province.
Durante el 18 de
During
diciembre
from,
al
from
31 de
December 18
diciembre del
to
año
December
2020,
29 of
se
2019,
reportaron los primeros
the
5
first
casos,
5 cases were
de los
reported,
cuales 4 de estos
of which 4
pacientes
of
fueron
these patients were
hospitalizados
hospitalized
por
for
presentar un síndrome de
acute
estrés
respiratory
respiratorio
distress
agudo
syndrome,
y uno de estos
and one of
pacientes
these
falleció.
patients died.
Precisamente el día
Precisely
9 de
on
enero
January 9,
se dio a conocer en el mundo el fallecimiento
the,
del primer caso
the death of the first case
de, del SARS en el
of this
mundo, producido
SARS-CoV-2
por el SARS.
was informed.
El primero de enero
On
precisamente
January,
este año,
by January
o
1st
sea,
of
del
this
año
year,
2020, el mercado
2020,
de Wuhan
the
había
Wuhan
sido
market
ya
had been
cerrado
closed,
y no existía
and there was
registro
no
de
clear
transmisión de
evidence
persona a
of
persona.
human-to-human transmission.
En ese momento,
At that
en
moment,
enero ya había un
by
total
January,
de
there was a
41
total of
pacientes
41
que
patients
habían sido
that had been
hospitalizados y solo
hospitalized,
un paciente
and only one
presentaba
patient who
patologías
had serious
preexistentes
pre-existing
que
pathologies
había fallecido.
died.
Inicialmente en los hospitales
In the
se
initially
buscó
in the
como
hospitals,
diagnóstico
the
el
diagnosis was
síndrome respiratorio agudo
a
de
study for
SARS.
SARS,
Eh,
acute respiratory syndrome, and was not found.
Luego del síndrome
Then
agudo
of
gripe
the Middle East
se
respiratory
descartó
syndrome
y tampoco encontraron.
and was not found
Se buscaron
or
otros
ruled out.
virus. Se buscaron
Adenoviruses were studied,
quizás virus
all
producidos por
other
influenza,
influenza
de
viruses
gripe aviar,
from
y se
avian
encontró
flu
lo que
and
fue un gran
were ruled out.
desconcierto
So this
en
created a lot
los
of
médicos
issues
tratantes
and
y la
on
angustia
treating physicians,
comenzó a incrementarse
and the anguish
cuando
started
ya
increasing
vieron que
when
la
they
enfermedad
realized
se
that
iba
the disease
distribuyendo
was spreading
progresivamente.
progressively.
El 7 de enero, las
On
autoridades
January 7,
chinas
the Chinese
lograron,
authorities
anunciaron que habían
announced that they had
identificado
identified
un nuevo tipo
a new
de
type of
coronavirus. A
coronavirus.
este nuevo tipo
So
se
this
le
new type of
considera
coronavirus is
SARS,
what we call
SARS-CoV-2.
SARS-CoV-2.
Simultáneamente, otros posibles
Simultaneously, other possible
fueron descartados.
pathogens were ruled out,
Se logró
and
descartar el
we were
síndrome
able to rule
respiratorio
out
agudo severo,
the
el síndrome respiratorio
severe acute
estadounidense,
respiratory syndrome,
el
the
virus
Middle
del
East
aviar,
respiratory syndrome
el
virus,
virus de influenza aviar
the influenza virus,
y
the
el
avian
adenovirus, como ya habíamos
influenza
mencionado.
virus, and the adenovirus, as we mentioned.
A partir de este momento, las
From this
autoridades
point
a nivel
on,
mundial
the authorities
supusieron
worldwide knew
que enfrentaban
they were
un
facing
nuevo
a new
virus
threat, a new
y
virus.
esto se aunó a la
And this
situación que en ese
came
momento
together
se
with the
vivía en
situation
el
that at
pueblo
that
chino.
time was being
Como ustedes
experienced
saben,
in these
en ese
Chinese
periodo
people,
vacacional
that
se
in that
moviliza
holiday period there's a
gran
lot of
masa de la
traveling
población
of a
china
large
para
mass of the Chinese
recibir el
population
año nuevo
to celebrate
chino.
Chinese New Year.
Siguiente, por favor.
Next slide, please.
El 13 de enero del
On,
2020
on January
ya
13,
comenzó
2020,
la evidencia o se dio evidencia de la
we
presencia
had evidence
y
of the
persistente de la
presence and
enfermedad,
spread of this
la
disease,
presencia en otros países.
the presence in
En
other
Tailandia
countries. In Thailand,
se presentó el primer caso
the
en
first
una
case was
nacional china
reported in a Chinese
que arribó a
national
Wuhan,
arriving from
la
Wuhan,
provincia que había sido
the province
inicialmente
that
afectada.
was initially
6
affected.
días después,
6 days,
16 de enero, se
or on
confirmó el primer
January
caso en
16,
Japón
the first case
de
in
un
Japan
ciudadano japonés
was confirmed of a
viajando.
Japanese citizen
El
traveling to
día
Wuhan.
19
And on
se
January
reportó el
19,
primer
the
caso
first
en
case was reported
Norteamérica
in the Americas
y en el estado de
and in the
Washington,
state of
Estados Unidos,
Washington.
un paciente
A
que acudió a
35-year-old
una
male
reunión familiar en Wuhan
from Wuhan after
y
visiting a
falleció.
relative
La
and got
siguiente.
ill. Next slide.
El 24 de enero se
On January
reportó el primer
24,
caso en Europa,
the first case was reported in
específicamente en
Europe.
Francia.
Specifically in
Era
France,
un turista que había
is a
estado en China
tourist that
y
had visited
presentó
China
todos los síntomas
and
de la
presented
enfermedad.
all the symptoms of the disease.
Y de ahí,
And,
en
from,
un periodo bastante largo,
and
de un mes,
in 1 month later,
precisamente el 26 de febrero,
on
el primer
February
caso
26,
en
the
Brasil,
first case was reported in
en un
South
paciente
America
brasileño
in a
que no
Brazilian
había
patient
sido afectado en China,
who was
sino
not
más bien en
in
Italia,
China, but instead
dando
it was in
evidencia de la
Italy,
dispersión ya muy
showing
avanzada
evidence of the
de
high
la
spread
enfermedad.
of the disease.
Siguiente, por favor. El 30 de enero del año
January
2020,
30 of
el director general
2020,
de la Organización Mundial de
the
la Salud
WHO Director
declaró
General
que el
declared
brote
that the
es
outbreak
una emergencia
of
en salud
uh,
pública
a
de
public health
importancia
emergency
internacional.
of international importance.
Y ya había, este proceso se había
And this
dispersado
process had
hacia
already
4
disseminated
países europeos
to 4 European
por otra parte
countries
del mundo, como
and other parts of the
Alemania,
world, such as
Japón, Estados
Germany,
Unidos y
Japan,
Vietnam.
the US, and Vietnam.
Y un punto importante
Something
es
important
que
to mention
se había
is
acumulado
that
ya
it
98
had
casos
accumulated 98
en
cases
18 países
in
fuera de China.
18 countries
No había
outside
habido
China, but
tampoco
with no
evidencia de
evidence of
siguiente.
fatalities.
El 30 de enero del año,
January,
perdón, la pandemia llegó
the
a los países
pandemic
andinos.
reached the Andean
El primer
countries.
país que
The
reportó
first country that
el
reported
primer caso fue
the
Ecuador.
first case was Ecuador
Fue el 29 de
on
febrero
February 29 of 2020,
e inmediatamente se tomaron medidas
and the
de
measures were taken
restricción
immediately in
de la
terms of
movilidad. Se
restriction,
iniciaron las cuarentenas y los cierres de
quarantines,
fronteras.
confination, and the
El 16
border
de
were
marzo
closed.
se decretó
On
el
March
estado de
16,
excepción.
the state of
El toque de
exception
queda
was
desde
declared
las 9 de
and
la mañana
curfew
hasta las 5
from
de la
9
mañana
p.m. to 5
y
a.m.
la suspensión
and the
de todas las
suspensions of
actividades,
all the
incluyendo
activities
las de industria, excluyendo las
except
de
for
industria,
agriculture,
agrícola, de salud,
livestock,
bancos y
health,
comercio.
banking, and food
Es
industry.
decir, las acciones esenciales
So the essential
permanecieron
actions
para atender a la población
stay
que había sido
open
cuarentenada.
to
El 22 de
take
marzo
into
se decretó
consideration
de
the
8 a
population that
16
was
horas
under
las
confinement.
restricciones de
On
movilización.
March 22nd, there was
Chile
restriction for
pasó el
mobilization from
siguiente
8 a.m. to
el
4
día
p.m.
3 de marzo.
Chile was the second country affected, and on March
Se
3,
identifica el primer
the
caso
first case was
y el
identified,
18 de marzo
and on March
se decreta el
18,
estado de
a state
excepción
of emergency was declared
en
for
todo el país
catastrophe
durante
throughout the
90
country for
días
90 days,
y se cierran
and
las fronteras.
the borders were closed.
Bolivia reportó el primer
Bolivia
caso el
reported
10
the
de
first
marzo
case on March
y el
10,
11 de marzo
and on March
se
11
declara
declared a
emergencia
national
nacional y
emergency
se suspenden las
and
clases en todos
suspended
los niveles
classes
hasta
at
fin
all
de mes.
levels until the end of the
Y
month.
hay prohibición
And
de
there
todas
was
las
a
aglomeraciones de
banning
personas
of gatherings of more than
y se
100
cierran
people,
todos los
and
accesos
all the
en las fronteras.
borders were
Siguiente.
closed.
Siguiente, por favor. Colombia presentó su
Colombia
primer caso el
presented
6 de marzo
first case on March 6
del año
of
2020
2020.
y el 17 de marzo
On March
se
17,
decreta el
a
estado de
state of
emergencia y se
emergency
cierran
was declared
fronteras
with closure
terrestres
of
y
land, sea,
marítimas
and
desde el
river
10 hasta
borders
el 30 de mayo.
until May 3rd.
El Perú tuvo su primer caso el 6 de
Peru had
marzo
its first case on March 6,
prácticamente el mismo
2020,
día y mes que
the
Colombia.
same day and month
Y el
as
16
Colombia,
de marzo
and on
se
March
declaró el
15,
estado de emergencia
a state
nacional
of national
y se
emergency was
restableció
declared
las
and the
fronteras
borders
por
were
15
closed for
días,
15
lo
days,
cual se fue
which
prolongando
was extended
progresivamente por varios
progressively
meses.
for several months.
En Venezuela, el primer caso se reportó
The
el
first
13
case in
de
Venezuela was
noviembre
reported on March
y el
13,
18 de
2020,
marzo
and
se
on March
decreta
16,
el
a state of
estado
emergency was
de
declared
excepción para 7
of
estados
7
del
states
país
of the
por
country
la
due
presencia
to
del
the presence
coronavirus
of
y se
coronavirus.
cierran las actividades
Activities were
públicas y,
public
y
and
personales.
personal activities
Más bien se
were
restringen las actividades
restricted,
personales y se mantienen las que
and
son críticas de
the
salud.
critical activities were
Siguiente, por
maintained.
favor. Una investigación reciente
A recent
publicada en la revista
investigation
Science el
published
22
in Science
de junio del año
on June
pasado
22 of last
muestra
year
una
shows
investigación llevada a cabo
an
por 18
investigation carried out
expertos de la
by
Universidad de
18
Utah
experts from the
en los
University of
Estados
Utah
Unidos
in the
y
US,
el cual evidencia
and they
muy sólidamente
provide
la
solid evidence
presencia del
of the
virus
presence
en
of the
el
virus
mercado de
in
Guanán.
the
El
Wuhan market,
75%
Wanang market.
de los casos que se presentaron
75% of the
y
cases who
inicialmente en
were
Wuhan
initially
estaban
presented
relacionados
in
con este
Wuhan
mercado.
were related with
Sin
this
embargo,
market.
también
However,
hubo presencia
there
de
was also
casos
the presence of
sin
cases
relación
and their
con el
relationship
espacio geográfico en
to the
dos
geographical space
mercados.
in two other markets.
Este lugar era muy
This
especial,
is a
este
special
mercado de Guanán,
market in
debido a que
Wuhan
ahí se
because
llevaba a cabo venta de
they will
animales
be selling
exóticos vivos,
uh,
eh,
live,
como por
wild,
ejemplo
exotic animals such as
mofetas, zorros, perros,
foxes, dogs,
vampiros o murciélagos.
bats,
Y, y también se
and they also could be witness the expenditure or sale of fish and seafood, and they would detect two varieties of these initial SARS-CoV-2 virus, the type A and type B, in this market, which provided the possible explanation of why there was a presence of several cases from this market. And by studying the sites, they evaluated five places in the market. They found the virus in the walls of the drainage grates when they clean the fish and other animals. The cages were also positive, and the walls next to these places were also positive for the virus. But it was also important, it was to determine that this was an important place for disease transmission because most of the cases were related having been present in this market. The epidemiological studies indicated that there was a large number of patients who had directly go to buy food. And from there, the virus started spreading rapidly to the neighboring homes and then to the entire city. It is important at this, and with the analysis that we've done with our technicians, we were able to determine what was the impact of this pandemic on health and the environment. One of the most important elements that we were able to see, but there was an increase in inequalities with more poverty and less access to health services. We were able to identify through research and in the knowledge that we had through the Ministry of Health and the knowledge and the information from those ministries that there was a loss of response capacity of the health services because of an increased demand that was not able to respond, that overwhelmed the response of the health services. And we were able to identify what countries have a higher chance of providing a response due to the high demand, and identifying the possibility of having a best system for intensive care and access to hospital beds, intermediate care beds, and also emergency and diagnostic tests and the personal protective equipment and the medical oxygen, mechanical respirator mask, alcohol, gel, and gloves. There was a constant demand for all of these. But here is something very important. The low and mid-income countries were prevented of having access to the possibilities of having all these inputs and materials, equipment to treat their patients because we were not able to anticipate the large demand of these products. And number two, the countries with more economic capacity or high income bought some of these materials for the future.
las acciones
So this resulted
cobran
that
valor
the
en el sentido
actions
del aislamiento.
become the actions that were more
Está
important in this case
protagonizado
were
por gobiernos en el caso de los
isolation,
países andinos.
such as the
La
Andean
dificultad
countries did
del
due to
gobierno
the
atender
difficulty
estos
in being
insumos a
able
la
to
población enferma
have all
y
these
también
materials for
intentar
the
recortar la
population
transmisión por este
and
medio
try to reduce
del
transmission
aislamiento físico
through physical
de la
isolation,
población para permanecer en sus hogares y evitar los
so they should
contagios.
stay at home and prevent
Todavía no se
transmission.
conocía
We didn't
la
know
forma como
the
se
way
transmitía esta
that this
enfermedad
virus
Sin
was
embargo,
transmitted,
esa
and
medida
therefore
fue muy socorrida
that measure
y
was very useful,
extendida muchas veces.
but sometimes was not taken
En
into
razón de
consideration
que
as it should,
se introdujo algunos,
because there was the
eh, digamos, conocimientos no relacionados
introduction of
que
some
permitieron
information
informar
not
más
related to
respecto
the
del
science,
riesgo
but more to
y
the
el
political side,
desconocimiento de la enfermedad
and the
hizo
poor
que
understanding
estas
of the
medidas
disease
comenzaran a perder
made that some of these measures start
fuerza.
losing their
Otro
value.
elemento importante
Another
que logramos
important
identificar
element
fue que
that
nuestra
we
población
identify is that
necesita
our population needs
el trabajo regular todos los días
need to go
para
to
poder
work
llevar
in,
alimento a las
in
familias
order to
y eso
bring food to
también
their
fue
homes,
un
and
factor
that was
de
also
salud
an
enormemente
exposure
riesgoso
factor with
que hizo que
extremely
la
increased
transmisión de la
risk that
enfermedad
made
se
the disease
prolongara y se
transmission
hiciera
prolonged,
muy grave
continued,
en
and was
lugares con
severe
alta
or
concentración
serious in many
de
areas where
personas.
there were large concentration of
El
people.
tema de la calidad del aire, que desde ya
The
antes de la pandemia
air quality
era
that even before the
crítico,
pandemic
ya que
was
había una
already
contaminación
had a high
por
pollution
gases de efecto invernadero
because of the greenhouse emissions,
incrementaron este riesgo y
increased
hacían
this risk
poder
and
transmitirse la enfermedad.
how and
Los
increase the transmission of the
esfuerzos
disease.
de
The
aseguramiento
poor
en la población
available
hizo que
of
este
reassurance in
riesgo
the
cada vez
population made
fuera
that the
más
impact of the
alto
pandemic
y es así que
began
muchos
growing,
de los
and
países
it was so that
andinos
the Andean
sudamericanos
countries or countries in South
se
America
convirtieran en el foco
became the
de la transmisión de la
area
enfermedad
of disease transmission
en el año, a fines del año
at the
2020
end of
y todo el
2020
año 2021
and
e inicios
throughout
del año
2021
2022.
and 2020,
Siguiente.
part of 2020.
Eh, ¿Cuáles eran o son las medidas
What
sanitarias
are the
que son
sanitary
conocidas
measures
y aplicadas?
to be strengthened and applied?
Está demostrado
It's
y
been
está
demonstrated,
evidenciado
it's been
que la
shown
vacunación
that
es
vaccination
un instrumento clave
is a key
para proteger a
tool
la
to
población.
protect the population.
Múltiples investigaciones
Several
de
investigations and research
demostraron
throughout the world have
que las
demonstrated
personas que
that
recibieron
people
la
who
vacunación
receive
correspondiente
the
evitaron tener
corresponding
las formas graves
vaccination,
de la
preventing of
enfermedad o
having the severe
evitaron
forms of the
morir.
disease or did not
Y
die.
es indicativo, yo lo voy a
And as
decir
I'm going to
con
demonstrate
gráficos, cómo
later,
luego de las
how
campañas de
after
vacunación
the vaccination campaign,
la mortalidad cayó
the
sensiblemente, la transmisión
mortality
de la enfermedad se hizo mucho menor
fell significantly with less
las
transmission of the
hospitalizaciones
disease.
disminuyeron
There was a decrease in
y nos
hospitalizations,
encontramos a este año.
and that is how we are at this
Es
year, present year.
importante
So it is
la
important
vacunación como un instrumento para
to use the
proteger a la
vaccination as an
población.
instrument to protect
Y
our
no hablo
population.
solamente de las
And I'm not
vacunas
talking about
contra el
the
COVID.
vaccines against COVID only.
La, nuestras poblaciones tienen múltiples enfermedades
Our population
que
suffer different diseases,
se presentan durante toda la vida del ser humano
and
desde
they are
nacidos.
exposed throughout their
Estas
life.
enfermedades
And these
transmisibles y
transmissible
crónicas
diseases
producidas por
and chronic
enfermedades
diseases
transmisibles
generated by
pueden
transmissible
ser
diseases
evitadas en
may be
razón
prevented
de usar
by
adecuadamente
using
la vacuna
the
y al
adequate
mismo
use of
tiempo aplicar
vaccines,
todas las
and
vacunas
also
para
offering all
recuperar
the
o
vaccines
recuperarnos del riesgo
to
de
recover
contagios a
from the
los que ya
risk
habíamos
of
derrotado y
coming
eliminado
down with
de las
diseases
poblaciones
that we have
andinas,
defeated and
como es
eradicated
esta
from the
enfermedad que es
Americas,
la
such
poliomielitis,
as measles,
y que son
polio,
necesarias también
and they are also required
que no nos nos olvidemos que hay otras enfermedades
But
que
we should not
están
forget that there are
desarrollándose
other
ahora.
diseases and not everything is
Es muy
SARS-CoV-2.
importante
So
retomar
it
la
is very
responsabilidad de
important
protegernos con todas las
to
vacunas.
protect against
Un elemento
with all the
sustancial
other
dentro
vaccines.
de dentro de
Important
estas medidas a
element
ser
in these
fortalecidas
measures that need to be
es
strengthened
la ventilación.
is improving
Se
ventilation.
demostró el año
It was
2022
demonstrated on
fehacientemente
2022
que uno de los elementos
that one
claves para
of
la
the key
transmisión de la
elements
enfermedad
for disease
es la
transmission
producción de
is the generation or production
aerosoles
of
que
aerosols
incuban, que
that
permiten la presencia
allow the
del
presence
virus flotando en estos
of this virus
aerosoles y se
floating on
concentran
these
en
aerosols
lugares cerrados,
and are
en lugares
concentrated
con
in
poca
close
ventilación, en lugares
areas
donde
with
hay
poor ventilation,
constante presencia de personas.
where
Y
there's a lot of
entonces
people
ese es un
present or
factor
crowding. So
crítico
this is a
para la
critical
transmisión.
factor
La
for
presencia de estos
transmission.
aerosoles
The presence of these aerosols
ha sido
has
comprobado que es un
been
factor de transmisión.
demonstrated as
Por
a
ello,
transmission factor
es
for the
necesario
disease,
mejorar
and
la
therefore we need
ventilación
to improve
de todos los
ventilation of
espacios
all
de trabajo
the
en
working
los
spaces
transportes y
in
también en los
transportation,
hogares, ¿no?
in our homes.
Ventilar el lugar hace que
To
estos
ventilate
aerosoles se
the space
dispersen y
makes
ya no
these
se
aerosols
conviertan en un riesgo.
scatter
En
and get
algunas
dispersed and do
industrias
not become a
importantes
risk.
y colegios
In some
y
industries
centros
or
deben
schools
tener la
or
capacidad
homes,
de poder tener medidores de CO2 ha servido de mucho en
in these
conocer la
areas,
concentración
it's been
de
important to learn
CO2
about the
y
concentration of
de
CO2
cantidad crítica
and the
que
critical
hace que
amount,
se aplique mecanismos y medidas para
which generates
mejorar la calidad
mechanisms
del
and
aire,
measures to improve the quality
reordenando
of air by
ese aire y
ven-
eliminándolo al espacio.
ventilating that air.
El uso de las mascarillas implica la necesidad de
The
tener toda una
use of mask
estrategia para su
implies a
uso.
strategy
Ya no
for its use
utilizar
itself.
las mascarillas de tela que inicialmente
Initially, they were the
la
cloth
respuesta, luego de
face
muchos
mask,
estudios, se
and after
corroboró
several
que la mejor
studies,
calidad de las
it
mascarillas
was
es
shown that the
la
best
habilidad de
quality
contener
of
al
the
virus y
masks
también saber
they had
utilizarlo
and
como
to
método
learn
de
how to
prevención
use a
en
mask
el
at the
lugar
proper
preciso.
time and in the proper
Ya sabemos
place.
que en los
We
espacios
know that in
aireados, el espacio
ventilated
físico del
space,
parque, de los lugares
in
ventilados,
parks
altamente
or
ventilados,
ventilated, highly
se
ventilated
puede hacerlo,
areas,
pero sin embargo en
you
los lugares
can
donde
skip the use of
cerrados,
mask, but
donde
in
haya
closed environment
espacios abiertos,
where
pero con
there are
mucha concentración de
open
gente,
spaces but
es
with a lot
necesario
of
utilizar
concentration of people,
mascarillas y
it's
en
a
ese
good idea to
punto
use
los
face masks.
ministerios andinos
And in
ya
that
han
regard, all the
comenzado a
ministries
hacer
from the Andean region have
políticas o
started
protocolos del uso
to
de las mascarillas.
generate
Debemos
protocol for the
recordar
use
que
of
la
these
comunicación
masks.
ante la pandemia son necesarios. La
New
población,
pandemic communication
luego del
strategies
estrés
are
que recibió en
necessary
los primeros
after
años,
the
se
stress in the
reforzaron
first
porque
2 years.
ya vieron que no había
They
ingreso
realized
de pacientes en
that there were no
hospitales.
more
Pero como
admission to
decía la
the
doctora María del
of patients to
Carmen
the hospital, but
en
as Dr.
en
Mary
una
Carmen
presentación,
mentioned in her opening
la
words,
COVID prolongada se puede
the long
experimentar
COVID
en personas
can
que
be
han
seen
tenido
in people
inclusive
who
formas leves
had mild forms,
de COVID.
even in people who had mild forms of
Sin
COVID,
embargo, luego de varios meses pueden
but
permanecer
several months later,
lesiones
they can still have
en un gran
some
porcentaje que se dice entre
lesions
20 y
that can get
30%
up
de las
as
personas
high as 20 or
que tuvieran
30% of
COVID
people
pudieran
who
hacer
had COVID
estragos que
could
pueden generar
send these cases that
complicaciones un
generate
poquito más complejas.
some more complex
Y
systemic involvement.
es necesario mantener
So we
un
need
adecuado
to maintain
sistema de
an
vigilancia epidemiológica y
adequate
genómica. Y es así
epidemiological
que
and genomic surveillance system.
habló Patricia
As
de la
Patricia
vigilancia
mentioned,
genómica
of
y que
genomic
complementa
surveillance
y que
that
va a tener que
complement
tomar una especial
and is going to have
presencia
a special presence
en el poder llevar a cabo
in being
vigilancia
able
genómica
to
ya no
carry out
solamente del
genomic
virus,
surveillance, not
sino
only
también
from
de
the virus,
bacterias,
but also of
también de hongos,
bacteria,
de otros
fungi,
seres
and other
que producen
organisms
enfermedades,
that
¿no?
produce
en el lugar.
peace in humans.
Acciones de contingencia frente a
Contingency
variantes de
planning
preocupación
actions for
y u
possible
otras
variants of
futuras
concern and
pandemias.
or future
Se ha
pandemics.
evidenciado que
It
aquí
has been
Latinoamérica
evidenced that
puede
this
tener la posibilidad
pandemic
de replicarse en un corto periodo de
may
tiempo.
replicate in a short
Y
period of
no
time.
sabemos
And we don't know
cuándo, pero hay
how long it's going to take or when,
la
but
necesidad de
there
tomar
is a need
medidas en salud
to
pública
take public
para
health measures
cambiar los paradigmas
and to
que nosotros
change the
tenemos en cuanto
paradigms
a la
that we have
vigilancia
in terms of
y la necesidad de
surveillance
incorporar
and the
a
need
otros
to
actores que
add
no
other
necesariamente tienen que ver con
stakeholders that
salud.
are not
En
necessarily have to
esta
do with health,
pandemia nosotros hemos
but in
visto
this pandemic
que
we've seen
para poder interpretar la
in order
situación
to interpret
epidémica
the
y el impacto
epidemical
en la población,
epidemic situation and impact on the
necesidad
population,
de
there
tener
was a need to have
economistas, de tener expertos
economists,
en
uh,
comunicaciones,
communication
expertos en
experts,
sociología y antropología,
sociology and anthropology
expertos en
experts,
climatología
experts in
y
climatology,
también en salud
and
animal.
also in animal
Es
health.
decir, que
So
en todas las partes del mundo se ha
in all
evidenciado la
parts of
necesidad
the world, there
urgente
was an urgent
que
need
haya un cambio
to
sustancial
have a
dentro de la
substantial change
vigilancia
in
y
terms of
la
surveillance
vigilancia epidemiológica y la
and,
respuesta
and
a los
the
problemas
epidemiological
presentados.
surveillance and the
Y
response to the
por la razón,
problems
y
presented
aquí
by the
vemos en el
pandemic.
punto 7
And here we see
es
in item
la
7
información
the
digital.
development of digital
Y lo puse aquí
information. And I
porque
put it
ya
here
se vio durante la
because
emergencia
during the
que es
emergency,
necesario
we
tener
saw that there's a need
sólidos
to have a
sistemas de
sound
vigilancia, pero
and
que no
solid
solamente en
surveillance
temas de
system
salud,
that not only
sino que
looks
incorpore el tema de
or
laboratorio y de vigilancia
uses
epidemiológica.
laboratory and
Segundo,
epidemiological
la
surveillance data. It's
vigilancia
much
tiene
more
que
than
ser
that.
más integral
Surveillance needs to
y
be more
tener
comprehensive.
herramientas
Having
fuertes,
tools
robustas,
that are
fortalecidas
robust enough
y poder
that can
incorporar información de diferentes fuentes,
use
integrarnos
information
a
from
las
different
informaciones,
sources and to
mejorar
integrate this
nuestra capacidad
information,
de análisis,
improve the analysis
interpretar mejor
capacity,
esta
and do a
información
better
y compartirla en unas
analysis of this
áreas
information
sociales
and share
para
it for some
análisis
technical areas and to
y para
social
ciertas
areas and
comunicaciones.
for
Y
communication areas.
naturalmente también
And of
para los
course,
que toman,
for
las áreas
those
que toman
areas
decisiones.
for in the
No
decision
se
making,
puede seguir manejando un
we can no
sistema de
longer
información
have an
arcaico
information
que
system that is
redunda en
outdated
ingreso de
and
información
redundant in the
meramente
input
manual.
of
Ahora,
manual
la
information.
automatización es muy urgente que se
Automation
incorpore
is extremely
dentro
important to be
de los
added
sistemas
to
y se
these
tienen
systems.
algunas instituciones
Some
como
institutions
estas
do
para
have
hacerlo.
this.
Los bancos han demostrado ser muy
Banks have
buenos
demonstrated in a
generando
short time that they can
información
generate
a
this
través
information
de
through
un aparato robusto de
a
información.
robust
Y
digital
en el
information
caso de
system
salud,
as
muchas
well.
otras instituciones
And in the case
necesarian
of health and other
incluir en
institutions,
todas sus bases
we
esta
need them to
información
integrate
para
all
poder
their
tomar mejores
information that
decisiones. Siguiente, por
for
favor.
decision making.
Desde el ONU,
From the
nosotros
Horas
hemos
Conu,
recibido ya
we have
a través de diferentes reuniones
continued through
con
different
las autoridades
meetings with
promovida por nuestra
high
secretaria
authorities promoted by our
Carmen Liliana
executive,
Meneses Huesca,
executive secretary Carmen
era
Calle,
muy importante
and it was very
ahorita
important, number one,
fortalecer
to
la
strengthen
integración
the
epidemiológica.
integration of
Desde la
this
ONU siempre se ha
block.
defendido la
In Horas
necesidad
Conu, we always defend
de mantener
the
unidos a
possibility of
los 6 países
maintaining the
y a
six
los
countries
ministerios de salud
together and to their
con la
ministries
razón
of health,
de que es necesario
because there
compartir
is a
todas
need
las
to
tecnologías
share all the
sanitarias,
health
todos los
technologies,
avances
all the
que han
achievements,
logrado aquellos
progress
ministerios de salud, porque
from each
precisamente
Ministry
han
of Health,
estado
because it is
en el
precisely
espacio
this
de
have been
intervención,
in the
en las áreas de
intervention space
combate,
in the
y ellos han
area combat
experimentado y
zones, and they
conocido
have
a través
experienced and learned
de muchas acciones
through many actions
protocolizadas y también por
that
experiencia
follow protocols
de
and also
consumo de
due to
sus
their
expertos, la
own
posibilidad de ser
expert
más
experience,
eficaces
the
y
possibility
para
of
ahorrar tiempos y
fighting
para
against
ahorrar
this process in
también
order to save time
economías, es
and
necesario
economy.
que ésta sea compartida
We
entre
need
sí
that this
y
be
se haga
shared. This is one
tristemente
of
un
the
trabajo
critical elements
asistenciado en el organismo andino
of work
junto
of
con
this institute,
países y secretaría ejecutiva.
countries
También
and executive secretary.
compartir
Also
todos los materiales
share
y insumos
all the
que
materials, inputs, and
se han dado
critical
esa
medications.
situación que
There are
era
spaces and
necesario
moments where there was an
establecer
urgency
comunicaciones ocultas
to
entre
share joint
países en el
actions
escenario de frontera. Y esta
between
comunicación
countries in the
permitió
border
salvar
areas,
vidas.
and this
Para
has
este
allowed to
trabajo,
save
el
many lives.
proceso debe
However, this
mejorarse
process
y
needs
ampliarse
to
a
be
través de
improved and expanded
instituciones
to other
que permitan
institutions
el paso de
that
materiales
allow
como
the
científicos
passage of
de las
material staff
fronteras ante
input
procesos como
through
el
the
que ocurrió en
borders,
la pandemia.
such as
Las investigaciones
situations
conjuntas
like
son
the pandemic.
necesarias y
The
aquí hay otros
joint
factores que deben
research
considerarse
efforts are
y que es
important,
muy importante que
and it is very
se
important
presenten o tengamos alianzas con la academia,
to
con
promote alliances with academic
especializadas.
institutions, with
Para
specialized
permitir
institutions
incorporar
that are going
conocimientos
to
científicos
allow
y
the
técnicos
addition of
que son
scientific and technical
imprescindibles
knowledge that are
en
needed
todo
to
el
share
sistema para
between the
fortalecerlo.
entire systems to
Y
make it stronger.
ya les decía,
And as
hay
I mentioned,
necesidad de
there is the
incorporar
need
a otros
to
actores
add other
que sean
stakeholders from the
fundamentales
society, from the
de las
community,
políticas
of
locales que
political
tienen
and local
capacidad
authorities
y
that
tienen mandato para poder
have a
resolver
mandate to
problemas,
solve
pero ellos necesitan el
problems, but
apoyo
they need the
o los
support
instrumentos y herramientas
or the
necesarios para
instruments and
tomar
necessary tools
decisiones para
to
defender su salud.
make decisions
Y hay
in
un
favor of health.
aspecto que es fundamental
And
dentro
there's another
de su
important
decisión.
aspect to
Los objetivos
consider.
de desarrollo sostenible son
The
necesarios
SDGs are
y
required to make
no deben
progress.
ser atendidos a la
Not
vez
all
por
of them
otras
can be
prioridades, como por ejemplo
taken into
el sistema
consideration at the same
de
time, but
salud,
there's some
la
priorities
salud y el
like end
bienestar,
poverty, zero
la
hunger,
educación de
health and
calidad y
well-being,
igualdad de
and
género,
quality
sin duda.
education and gender equality.
Ya muy rápidamente
Now, very
les daré
quickly,
información
I will
sobre
provide
la situación
information
en China.
about the situation in
En,
China.
en el mes de diciembre se
In
tuvieron
this last
informaciones
December,
por
we
medio de
received
algunos noticiarios
information through the media
que el sistema de salud en
that
China
the
había sido
Chinese health
saturado
system
y que se
had
presentaban
been overwhelmed and that there was
prácticamente
a significant
cientos de
number
casos y fallecidos
of
que hacía
deaths
muy
and cases
complicada la
that made
atención
the,
de los pacientes
the care of
hospitalares
patients quite
para
complicated because the
pacientes
hospitals were
de cáncer.
overflown and full of
Siguiente, por
cases.
favor. Se tomaron medidas también
Measures
que
were taken
trajeron intervenciones políticas
that brought political
en el cierre
interventions
de las fronteras, en
with
este caso
border
entre
closure, in
Corea
this
y
case
Japón,
by Korea
y
and
que
Japan.
China inmediatamente respondió
China immediately
con
responded
el cierre
with
del envío
the close
de
with the
visas para
suspension of the
visitar
issuance of
estos
visas
países, ¿no?
to visit these countries.
Esto traía no solamente acciones para el
This
turismo,
not
sino
only
también
brought had actions
comercial y laboral.
against
Siguiente.
tourism, but also commercial activities and travel.
Al 16 de enero se tuvo
On
el informe
January
del Comité Nacional de Salud de China,
14,
que
the
informó que
China's
se
National
habían
Health Committee
registrado
reported
muertos
that nearly
desde el 8 de
60,000 people
diciembre de
had died
2022.
since December 8, 2022.
5.000 de estos pacientes
5,000 of
fueron
these
por
patients
insuficiencia
were due
respiratoria,
to
pero la
respiratory
mayoría,
failure,
el
but most
90%,
90% of those
eran por
who
haber tenido
who
enfermedades
died had
complejas, ¿no?
complex diseases
Subyacentes, como
that were
cáncer,
such
enfermedades
as cancer, cardiovascular disease,
cardiovasculares.
lung or kidney
La media de
diseases.
edad de las personas que
The
murieron en
mean
China fue
age of people who died in Chile
103
was
años de
80.3
edad
years,
y
and
90% de
90% were 65
65
years
años, es
of
decir,
age or
la
older,
población más susceptible.
so
Adelante.
the more susceptible population.
La pandemia de COVID en China
The epidemic
evidenció
in
la
China
necesidad,
evidence
según
need,
este grupo consultivo
according to
chino,
this technical
que
advisory
dio
group,
recomendaciones
which
para
recommended
analizar cuán grave
first
era la
to analyze
situación.
how
Lo
severe the
encontrado fue
situation was, and they
que
found
estaban circulando
that there
virus
were circulating
de la
virus
misma
from
variedad
the
que hay en
same
Europa. Es BA5,
varieties of Omicron BI5.2 and
BF.5. Entonces,
BF.7.
el 95%, el 97% de las infecciones
97.5% of
eran
the infections
las mismas que en
were the
Europa
same
tenían,
ones as in
por lo que
Europe,
no
so
era necesario
there was
restringir
no need to
eh,
restrict
el comercio
trade
y tampoco las visitas entre los
or visits in the European countries and China.
Se reitera la necesidad
It
de
reiterates
realizar
the need,
una estudio
importance
adicional
of
sobre
further
el modelo de
analysis.
gobierno chino que incorpore
The Chinese
información en los
government was asked to
diferentes
add
redes
information in the
de
different
diagnóstico de la
networks
enfermedad
for
y es así
disease
que
diagnosis,
se pidió que ingresen
and
los
they
datos de
asked to enter the
genotipicación
data of
en GISAID,
genotyping
que es una
in
red
GSAID,
específica para
which is
ver
a big network
contenidos de
to
virus y sus
look
genomas,
at
y
virus
también
genomic
la
studies,
necesidad de
and
incluir
also the need
información de los
to
casos y su distribución. Siguiente.
report the cases and the distribution.
En este momento, ¿cómo está la
In this
situación
moment, what is the
COVID-19?
situation in the world?
Tenemos
We
672
have
millones de casos confirmados
672
acumulados
million
desde que se
cases
inició
confirmed
la
since
pandemia
the
y
vaccine started,
6.7
and 6.7
millones
millions
fallecidos.
of deaths
6.7 millones de fallecidos en todo el mundo.
throughout
La
the world.
letalidad promedio es
Letality is
1%
1%,
y la cantidad de casos por millón es
and the number of cases
85.000
per million is
y fallecidos por
85,000,
millón
and deaths per million
853.
is 853
¿Qué
globally.
continentes son los más
What
afectados?
continents were the most
En números
affected?
absolutos
In absolute
acumulados hasta el
numbers and
momento,
accumulated numbers
Europa
up
es
to
el que
today,
tiene la mayor
Europe
cantidad de casos,
leads the way
con
with
36%,
36%,
segundo Asia y tercero
followed by
América. Como les decía, América
Asia and then America.
básicamente con una
The
población
American,
menor
the
está
Americas
en
with a
segundo
lower
lugar.
population was in
Este
fourth
no
place.
tenía, perdón, se había convertido durante
It
2
had
años y medio
become
en el centro
in
de
two and a
la
half years
pandemia
in
mundial
the
con casos y
center
fallecimientos.
of pandemics with cases and deaths.
Y la letalidad mayor
And
en este
the
momento es en
highest
África con
lethality at this
2%.
moment is in Africa with
Y la mayor
2%.
cantidad de
And
casos por
most of
millón
the cases
está
per
en
million
Europa,
are in
luego
Europe
sigue Oceanía
and
y
Oceania,
América.
and
Y
then the
fallecidos, la
Americas.
mayor
And
cantidad está
death
en América,
had the largest number
segundo
in the Americas,
Europa
followed by
y
Europe,
tercero
followed
Oceanía.
by
Siguiente.
Oceania.
Siguiente, por favor.
Next.
¿Qué pasaba en los últimos 7 días?
What happened in the
En
last
diciembre
7
del
days?
año
In February of
2022 se llegaron a
2022,
las cifras de 18 millones
we
de
had
casos
18 million
por
cases
semana en el
per
mundo.
week throughout
Pues
the
en este
world.
momento tenemos
At this moment,
2 millones,
we have
2.1 millones de casos
2.1 million cases
por semana. ¿Sí?
per week.
Es un número grande de todos
This is
modos.
a
Sin
large
embargo,
number in
como
any
ven,
case,
la
but as you can
mayoría
see,
de los países, salvo
most of the
África,
countries
han
except
disminuido con
Africa have
respecto de
decreased
sus
with
casos con
respect
respecto a la semana
to
anterior.
the previous
En
week.
cuanto a fallecidos,
In
también
case
la
of death,
mayoría ha
most
disminuido,
have
salvo Asia y
decreased
América,
except Asia
que
and
han aumentado
Africa
con respecto a la
have
semana
increased with
anterior.
respect to the
Siguiente.
previous week.
Aquí ven los casos
Here we
confirmados
see the
por
daily
millón.
confirmed
¿Sí?
cases per million.
Ven, por ejemplo, que Oceanía en
See
enero
that
11 de enero de
Oceania
2022 tenía
in had
1.962 casos y
1,962
Europa tenía
cases, and Europe had
1.483 casos por
1,483
millón
cases per
y América
million,
del Norte
and North
1.439
America
casos por millón.
1,439
Ya
per
en
million,
América del Sur
and
había
South America
disminuido
had
los
decreased
casos y ya
the
tenía
number of cases with
486 casos por millón.
486 cases per
Al
million.
día de anteayer, enero 19,
On January 19,
Oceanía tenía 1962 casos y había
Oceania that
bajado a
came from
176
1962
casos.
dropped to 176.
América de 1483 a 88. Entonces, el cambio
America
ha sido
from
realmente muy importante con
1400
respecto
to
al
88.
inicio
There was a
del
significant decrease
2022.
at the beginning of
Y la
compared
curva
to
la
the
pueden ver ustedes ahí.
year ago, and you can
Siguiente.
see the curves.
En fallecidos,
In
ven
terms of death,
que en abril del año
in April of
2021 se tuvo
2021,
la mayor cantidad
we
de
had the
fallecidos
highest
en la
number
historia
of
en
deaths
América del Sur.
in South America
911
with
fallecidos
9.11
por día
death per
por millón de
day
personas.
per million.
Pero a enero 17,
But on
América del Sur
January
tenía
70 of
0.33
this year,
fallecidos por día por millón de personas.
South America
Esa
has
correlación ha
0.33.
sido
So there's
alta
been
y
a
y
highly
es
sensitive
evidente que el impacto de la
decrease, and it's evident that the impact of the vaccines have brought on a sensitive decrease in morbid mortality. The countries that at this moment have most problems throughout the world, as of yesterday, we have Japan, Hong Kong, which is not a country, but is within the ones that have the largest cases per million per day. Taiwan, South Korea. In this graph, Uruguay is in number 9 and Chile in number 10. Bolivia is in 16th position and Brazil in 17. With regard to death, the Asian countries are the ones who at this moment have the largest number of deaths per million. Hong Kong, Japan, followed by Croatia, Taiwan, Germany. Chile is in 8th position. The rest of countries are basically from Europe. Of the vaccination throughout the world, we have 69.3% of the world population has received at least one dose. As we know, this is not significant because when they were vaccinated, these people were vaccinated, have no long, there's no more immunity. There's 5.7 billion people who received the second dose. At present, this is important, but not as important those who have received their third or fourth dose or booster dose. 13.2 billion doses have been administered worldwide. 2.7 million are administered every day. There's been a decrease in comparison to 2022 because we have a population that has been already vaccinated, but we should not forget that if we don't have the complete dosing schedule, the immunity is going to be at a critical level, and having one or two vaccines doesn't mean much. On the contrary, we need to have the necessary boosters indicated by the Ministry of Health for our risk population, the elderly and the young. And 20% of the population in low-income countries has received at least one dose. You can see that more than 70% should be the necessary coverage to prevent transmission of the pandemic type. However, the poorest countries, they only get up to 26% of people who have been vaccinated. Next, this is the distribution of vaccination coverage. South America was able to achieve, despite the economic difficulties, of the leading area in vaccination with the second dose, followed by Asia, Europe, North America, Oceania. As long as our vaccination is not adequately vaccinated, the presence of new viruses or new variants or subvariants puts us at risk of the emergence of a dangerous, harmful subvariant and re-emergence of the disease. Next. Well, these are the daily confirmed cases per million. And for the Andean countries, in the next slide, in March of 2022, in Chile, it's about 6.6 deaths per day per million. Now it has 1.22. And the rest of the Andean countries have significantly decreased their mortality. Today, we have in all the Andean countries 18 million of cases. There's almost 500,000 of deaths. Comparatively with the rest of the world, we still have more cases per million compared to the world mean. And in terms of death, we have the largest number of deaths accumulated per million. We need to understand that we were the most critical area of transmission, and that is why this accumulated data make be above the world average of cases and death. Next. In Bolivia, in the last 24 hours, they have 975 cases in the last 24 hours. Chile, 2,897 cases in the last 24 hours. Colombia, 7,930 cases of COVID. Ecuador, 20,476 cases, like increase. This is Colombia's the accumulated accumulation for 1 week. Peru, in the last 24 hours, has 279 cases. In Venezuela, 39 cases in 24 hours. An important statement that we have analyzed together, that COVID-19 pandemic has highlighted the inequality in health, making universal social and health protection, environmental care, with emphasis on the protection and access to water and food of the population, with strategic alliances between regional blocs based on the principle of solidarity and common good. All of these are indispensable. Thank you very much.
Gracias,
Thank you,
Lucho, por la
Lucho,
presentación.
for your presentation. Very excellent and detailed explanation. You have reminded us that this pandemic is already 3 years old, and you have made us remember when and how it started, the distribution from the initial countries, and then how it spread throughout the world, the impact on the health systems, and the progress that was made with the measures that the different countries put into place to deal with this situation that is still around us. You have also showed the distribution of cases, the distribution of death globally in South America, in the Andean region, and by country. And I think that's starting a lot of concern in our audience. And to continue, we will ask you to remain in the room for the Q&A. After these moments of learning and exchange of knowledge, it is essential to take some time to relax, to start a mini session of physical exercise during teleworking that we've been using. And in that sense, Horace Conjure encourages the well-being of those who accompany us in this virtual session. And in the next few minutes, we will exercise with an active pose to stay healthy, combat stress, reduce work fatigue, and keep muscles flexible and healthy. Please go ahead with the active pose. There will be no interpretation into English for this active pose.
Hola, hola, muy buenos días, buenas tardes. Desde el Organismo Andino de Salud y el Convenio Hipólito Unanue los invitamos a hacer esta pausa de relajación, un automasaje que te va a encantar. Siéntate, disponte de estos minuticos y empieza. Lleva tu cabecita hacia un hombro y hacia el otro. Empieza a dejar la relajación de tu cuello, de tu cuerpo. Inhala profundo, exhala, lleva la cabeza de adelante hacia atrás. La idea es que logres desconectarte unos segunditos de tu trabajo y puedas regalarte este pequeño automasaje. Lleva la cabeza hacia el hombro derecho, Con la mano contraria vas a empezar a hacer punzoncitos desde el hombro hacia el cuello. Haces como si la mano caminara, punzoncitos con fuerza que realmente distensionen. Todo el tiempo con inhalo por nariz, exhalo por boca. Eso es, de arriba hacia abajo. Ahora vas a colocar tu manita sobre el hombro y vas a empezar a hacer pequeños como pellizquitos del hombro hacia el cuello. Busca ese punto atrás de tu espalda que suele doler, que puede generar tensión y oprime. Esto también lo puedes hacer con un aceitico, una cremita. Ahí donde te encuentres, muy bien, regresa suave. Vas a llevar la cabecita al hombro contrario y nuevamente punzoncitos de arriba hacia abajo. Haz con la yemita de los dedos el movimiento, como caminando hasta el cuello. Inhala, exhala. Muy bien. Nuevamente manita sobre el hombro, pellizquitos de arriba hacia abajo. Intenta simplemente relajarte, descansar unos minutos. Haz movimientos acá en la zona del hombro. Masajeas, masajeas. Muy bien, ahora vas a llevar tus dos manitas atrás del cuello, vas a empezar a masajear y vas a hacer como que deslizan las manos de atrás hacia adelante, como si limpiaras tu cuello. Entonces, inhalo, exhalo, deslizo. Inhalo, exhalo, deslizo. Eso es. Ahora lleva tus manos hacia atrás. Mueve tus dedos de arriba hacia abajo, baja un poco tu cabeza y empiezas a hacer nuevamente los punzoncitos acá en toda la zona cervical, más que todo aquí donde inicia el cabello, masajea de forma circular. Este es un punto de tensión que nos ayuda a quitar dolor de cabeza, dolores musculares. Eso es. Masajea de arriba abajo. Eso, muy bien. Con las palmas, con la yemita de los dedos. Muy bien. Ahora vamos a terminar con un estiramiento que nos ayuda a terminar de relajar. Mueve ahí los hombros. Lleva la cabeza hacia un hombro. Mantén ahí unos segunditos. Recuerda la respiración. Inhalo. Exhalo. Cambiamos, inhalo, exhalo, palmas en forma de oración, colócalas en el mentón y sube la cabeza. Mantén unos segunditos ahí, inhala profundo, exhala, ahora al contrario, hacia abajo, hazle fuerza con las manos, muy bien, regresa. Eso es. A todos los países, Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela, desde los Lasconu, les agradecemos por esta pausa de tranquilidad, relajación. Espero te haya gustado. Chao, chao.
Muchas gracias por acompañarnos en este espacio
Thank you
de relajación en estos instantes.
for sharing this space of relaxation. And before going into the Q&A question, we would like to take this opportunity to thank for those of us who are listening to us, Argentina, Bolivia, Brazil, Chile, Colombia, Cuba, Ecuador, Mexico, Paraguay, Uruguay, Venezuela, and Peru. Also to thank for the institutions who are joining from the Ministry of Health of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, Navy Medical Center, the Ignacio Chavez Center from Mexico, Peruvian Red Cross, Lima office, the consultation, the roundtable to fight against poverty in Peru, maternal and child Juan Pablo II Center
Perú.
in Peru.
Y bien, para
And
iniciar ya este
to start
diálogo a partir de las preguntas que han
from
sido
the questions
enviadas por el
that
público,
have been
vamos
sent
a
by the audience,
invitarlos a nuestros ponentes
we invite
a
our
contestar y
speakers
voy a
to answer
seleccionar
the
las
questions, and
preguntas
I will
a cada uno. Vamos
read the
empezando con el
questions to each
doctor
one,
Jiménez.
starting with Dr.
Vamos a solicitar
Jimenez.
las preguntas para que pueda respondernos. ¿Cuáles son las
What
los principales
are
retos
the most
para la
important
secuenciación
challenges
genómica
for
de la vacuna
genomic,
de las
timely
subvariantes SARS-CoV-2
genomic sequencing
2019?
for
¿Qué
SARS-CoV-2 variants
relevancia
at present?
tiene realizar la vigilancia
What is the
genética de
relevance for
SARS-CoV-2
genomic
y otros
surveillance for
coronavirus en
SARS-CoV-2
humanos?
and another coronavirus in animals?
¿Cuándo aplicar las vacunas
And when to apply the
tercera, cuarta y quinta?
bivalent vaccines? Number 2, number 3, number 4. Could you please,
Doctora Jiménez.
sir? Dr. Jimenez?
Bueno, sobre los retos de la
Well, in
secuenciación
terms of the
genómica,
challenges
lo
for
que es
genomic
funcional
sequencing,
implica esa
beyond to
capacidad de
implies to
secuenciar
have
un
the
solo
capacity to
biotipo
do the
molecular,
a molecular
es un reto bien
biology
difícil.
laboratory,
Requiere
which is quite a challenge
capacidad
to have that
profesionales con el
capacity
equipamiento, con los
with
insumos
equipment
para poder hacer esa
and the
secuenciación,
staff
con lo cual
and
cuentan
inputs
todos nuestros institutos
which
nacionales de
all
salud
our national
pública,
institutes of
tanto
health in Vietnam
los institutos de
have.
salud pública del mundo están en capacidad de hacer
They
esa
are in the
secuenciación
capacity of
con
doing
éxito, con
sequencing, but
capacidad
beyond
técnica.
that
Yo
technical
creo que el mayor
capacity,
reto está
I think that the major challenge
en
is
poder correlacionar
in
los
do the
resultados de la
correlation of
vigilancia
results
genética
of genomic
con,
surveillance
con otros
with
campos
other data
científicos y
from the
tecnológicos de
epidemiological
vigilancia
or
clínica.
clinical
Es decir,
surveillance.
un reto es que
The
la
challenge is
secuenciación o la
that
vigilancia genómica no esté aislada
genomic
del conocimiento
sequencing should
general de
not be
vigilancia.
isolated from
Es
the
así que la vigilancia
general
genómica
context of
tiene que
surveillance,
existir,
because
porque
that
se
is how this
puede
genomic surveillance makes
utilizar
sense,
como elemento
because
para
it can
tomar
be used as
decisiones
an element
y
for
tiene que estar
decision making
conectada con la
and has
vigilancia
to be
de
connected
otros
to
aspectos
surveillance of other
científicos
aspects in terms of
de esta
the
situación.
behavior of this health
El
situation.
otro reto que
Another
creo que es
challenge
importante
that I
es
think that
la
is very
comunicación
important
en
is in
cómo hacer
communication,
esa
how we
información en
translate that
lenguaje muy
information
compleja, muy
that may be quite
especializado,
complex and very
en
highly
lenguaje
specialized
comprensible para los
into
pacientes,
understandable
para el
uh,
público en general, y
elements
para
for
aquellos
decision makers and
quienes
the
nos van
public at
a
large.
veces no solo es
So
vigilar por
it's
vigilar,
not only
la secuenciación
surveillance
es
for
saber qué
surveillance
hacer
alone,
después con todo
but
eso.
what do
Entonces
we
son
do with
algunos
all the
retos que
data? I think
enfrenta
that these are the major
todo este
challenges
tema de la
that
secuenciación
this
genómica
sequenciation genomic issue
y
faces.
conectado con la otra pregunta de la
And
relevancia
connected to the next question of the
de
relevance
hacer la
to
vigilancia
do
genómica de
this genomic
SARS-CoV-2 y
surveillance of
coronavirus
SARS-CoV-2 and other
en general,
coronaviruses in
pues tiene que ver
animals,
con que los coronavirus
well,
son
that has to do
transnacionales.
that
Es
coronavirus are
decir,
a large
que
family
afectan
of
a diferentes
viruses that
especies,
affect
no
different
solo a
species,
los humanos.
not
Y la
only
vigilancia
humans.
genómica del
Genomic
SARS-CoV-2 y
surveillance
la
of
investigación
SARS-CoV-2
que este virus significa
from the
para el humano
situation
abría
of
nuevas líneas de
this
investigación
vaccine implies for humans
para el
has opened
tratamiento
new
del
lines of
virus, de la
research
fisiopatología
for
de
several
coronavirus
studies
que
of
afectan
the
también a otras
virus that
especies de
affects
virus,
other
además
animal
del virus
species, other
original del SARS.
coronavirus that
Y
affect
además no
animals.
olvidemos
And let's not forget
que siempre estamos ante la
that
posibilidad
we're always
de
facing the
poder utilizar el
possibility of
coronavirus
dealing with
que
a
llegue a los humanos de una forma
coronavirus that
sintomática,
comes from humans from a
como
zoonotic
puede
source,
haber ocurrido
like it
con
may
el
have happened
COVID-19,
with
y
COVID-19.
tenemos que estar permanentemente
And we need to
alerta
be
a los
permanent
animales
at alert for the
potenciales de
viruses in
transmisión
animals that
a
have the
los humanos,
potential of
y en este
transmission
caso no me
to
referiré
human.
solo al
I will not
coronavirus.
talk only
Y
about
sobre la pregunta de
coronavirus.
cuándo aplicar
And
las
about that
vacunas
question, when to
bivalentes,
apply
bueno,
the
ahí se
bivalent
mezclan varios
vaccines,
temas.
well, there are several issues here.
Tener vacunas bivalentes
Having
abre la
bivalent
posibilidad
vaccines opens the
de cubrir un
possibility of
espectro
covering
de variantes
a
que pueden
spectrum of
escapar
variants that may
a la respuesta inmune
escape to the immune
y las
response,
vacunas
and
que están
therefore,
disponibles,
to the extent that they
cuando
are
ya hayan pasado
available,
6 meses
and where
de la
6 months
última
have passed
dosis
by from the last
de la
dose
vacuna
received
anterior,
of the previous
deberían
vaccine, they
porque
should be
esto
applied.
siempre tiene una
Of course,
racionalidad.
this also has
La
a rationale
racionalidad es
according
que
to
algunos
the
países y sectores
availability
usan
in the
determinadas
countries, and you
poblaciones.
prioritize
Una
specific
persona
populations.
mayor de 60
Persons
años
over the
que
age
ha
of
pasado
60,
6 meses de haber
6 months
recibido
after
su
receiving
segunda, tercera,
second,
cuarta
third, or
dosis.
fourth
Y yo
dose,
dispongo de bivalentes
and
sin
I have
problema.
bivalent, I will
¿Por
use
qué?
it.
Según lo
Why?
que está
Because
circulando, es
according to what
posible
we
que
are
esa
seeing,
persona se
it
infecte
is
con una
possible that
variante
person can be infected
a la
with a
cual no,
variant
no
for which
necesariamente está cubierta.
that
Personalmente
he or she is
hablando,
covered.
salud.
first-line staff, health personnel, regardless of have an ideally receive the 4 doses. If 6 months have passed by, we should use the bivalent. But if there's an increase in the availability of vaccines, the idea is to use the bivalent regardless of the number of doses received before, if 6 months have passed in the last dose. But we need to consider other factors that are not just technical and immunological, but also administration and prioritization. So we always do with the arrival of new batches to a country.
Gracias, gracias.
Thank you, Dr. Jimenez. Now we're going to ask Dr. Bengolea. 3 questions. What measures are being taken to prevent a new pandemic in the near future, or what other measures are required?
De repente se ha evidenciado, si te doy las preguntas o prefieres una
Do you want one by one, or with evidence the lack of transparency in epidemiological data reported in China? What risk may this imply? And finally, considering the process of coordination in several disciplines for epidemiological surveillance, is there any participation space that will include the civil society or other sectors or groups from the society? Go ahead, please. Well, we know and we promote and strengthen and promote that the Ministry of Health and other institutions related to health have the possibility of interacting and preparing protocols and proposals for the care of patients that may come down with the disease. But following for what has been expressed and has been witnessed in this pandemic, we not only need at this level of health just to improve protocols. Yes, they are important. The ministries are doing it. They are issuing protocols for vaccination. They're bringing the vaccine, the bivalent vaccine recently, and are vaccinating the population with campaigns in extra after hours, giving a more effort to this committed group of persons, of humans, that have demonstrated at the beginning of the emergency their enormous and great commitment. Both as professionals and techniques were in the first line of the battle, the front line of the battle, and they offered their time and were not necessarily understood at the beginning of the pandemic, but they are showing all what they've learned in order to move forward and obtain good outcomes. But we need to do more. This is a problem that affected the entire society. If it affects your way of life, affects how you live, we cannot do actions from area only. There are more potent actions that are required and are needed to get all the people, all the stakeholders together. Access to health is of utmost importance. We have the possibility that each inhabitant of a country have a minimally necessary care to deal with their health issues. Because as we mentioned, not only COVID, we have cancer, we have other chronic non-transmissible diseases, their accidents, etc. So there needs to be a substantial change in how we look at the human being and its production. The wealth generated must be shared equitably, or at least have those who generate wealth to access to this possibility and have better living conditions. Not only healthcare, to have a home, to have water, to have sewage, to have recreation, etc. Everything that we have been for so long, we should have access now. This highly needed. In terms of the lack of transparency, yes, actually, there's a lot of fear,
importante recalcarlos.
and it's important to highlight this.
Lamentablemente, mucha
Unfortunately,
de la información
much of the
es muchas
information
veces interpretada en ese
sometimes
sentido. Si hay más fallecidos
depends. If
o
there are
si
more
se
deaths
descubre más
or
casos
if we
en
discover
Latinoamérica,
more
ya
cases,
dicen que el
they
sistema es
say
malo
that the
o que
system is
el equipo es
bad,
malo o que el
or
gobierno es
the
malo,
equipment
etcétera.
of the
Y
government.
yo creo que tiene que haber un
I
entendimiento
think that there needs
en
to be an
la posibilidad
understanding
de
and the
conocer un poco en
possibility to
detalle cómo se enfrentan
know
estos problemas
more in detail how they face the
epidemiológicos
issues, in this case in
para
terms of public
saber
health,
que la identificación
to
de más
know
casos
that
no
the
quiere decir que el
identification of more
sistema
cases
está
doesn't mean
mal,
that the
sino
system
más
is
bien que el
fully
sistema está captando
operating,
los
but if
casos
the
que están
system is
apareciendo precozmente y de
including
manera
all the early
temprana.
cases.
La idea de que el acceso
The
a
idea
la
that
salud
the
pública
access
llegue
of
a las
health
poblaciones
reaches to
más
most
indefensas, digamos, ante la
defenseless
situación de la
populations
enfermedad y el aspecto económico, también
with
es
regards to
importante
the
darle
disease
más
and the
seguridad a
economic
esa población.
aspect. It's
Y
also
yo creo
important to
que
give more
en de
security
acuerdo
to the
a lo que está
population.
sucediendo en
Now, in
China,
terms of what we see in
hay,
China,
no se puede obligar a un país
we
a
cannot
dar
force a country
información. Lo que
to
tiene que
provide
ser
information.
es un
What there needs
sistema
to
más
be
robusto
is a
para
more
poder
robust
detectar los
system
primeros casos
to
y evidentemente
detect the first
tomar las
cases
medidas
and take the
necesarias.
necessary measures.
Y para ser sincero, no solamente
And to
se
be
da
honest,
en China,
not
se da en
only
muchos
in
países
China,
del
this has
mundo,
been seen in many
la
countries.
necesidad
There's a
de
need
tener un manejo
to have
más
a more
interno de la información, en razón de que
internal
muchas veces es muy
management of
utilizada,
information
¿no?
because many times it's
Y
misused
eso genera más caos y
and that
genera
generates more
más
chaos
temores.
and more
Con
fear.
respecto
And
a
with regards
espacio participativo que
to
incluya a la sociedad
spaces that
civil,
include civil
pues es
society,
fundamental.
well,
¿Sí?
this is
El
extremely
control
important.
de las enfermedades
The control
transmisibles,
of
el dengue,
transmissible
la
diseases,
malaria,
dengue,
no puede ser
malaria,
por salud exclusivamente.
it's not just the health
Por
sector.
ejemplo, un buen acceso
There's a
al
good
agua
access to
te
water,
da un mejoramiento en
provides
la calidad del
improvement
agua y
in the
va a
quality of
venir
water,
menos
and
enfermedades diarreicas,
less
menos
diarrheal
enfermedades
diseases,
parasitarias,
less parasitic
menos
diseases,
dengue,
less
¿no? Si toda
dengue
la población tiene
if all
acceso
the
al agua.
population have access
Muchas
to
veces
water.
la inversión
And
para
many
el
times
acceso
the
al agua, como
investment
así
to
lo
provide
demostró la
access to
epidemia del
water,
cólera en el Perú,
as we saw with the
toda la
cholera
inversión que se
epidemic in
hizo
Peru,
para
all
controlar
the
ese
investment
brote
that we do to
era
control this
suficiente y
zoonosis
más para
was
garantizar el
enough
acceso al
to
agua a toda
provide
la población
access
que
to
antes no la
water to
tenía.
the entire population that didn't have it
Esto
before.
es importante. Es un compromiso
Important.
social,
This is social,
político,
political,
económico y social.
economic.
Gracias.
Thank you.
Gracias, gracias por su respuesta.
Thank you
Hemos
for your
recibido muchas
answers.
preguntas,
We
vamos
have many
a tratar de
questions here.
agruparlas
We
en
try to
varias,
pull them
un poco para seguir avanzando porque el tiempo nos va
because
ganando.
we're
Tenemos
running
un
out
par
of
de
time.
preguntas para que puedan
A
ser
couple
respondidas
of
acá.
questions for both
La
of you.
primera es,
The
¿cuáles son los
first
cambios
is,
prioritarios
what are the
en los
priority
sistemas de salud
changes in the health
para
systems
fortalecer las medidas sanitarias?
to strengthen sanitary measures?
Y lo segundo es,
And number two,
teniendo en cuenta las consecuencias de la
considering the
pandemia de
consequences of the
COVID-19,
COVID-19 pandemic that we're suffering,
la pregunta es, ¿se impulsa
the
en los
question is,
sistemas de salud de los países andinos una planificación estratégica
do we need a strategic
que
planning for
garantice
the
la
Andean
utilización de
countries
recursos escasos para
that
ayudar a la
can
recuperación de sus
overcome with the
sistemas de
limitation
salud,
of resources,
especialmente en estas circunstancias de
especially in
emergencias,
these
desastres
emergency
y pandemias?
and disasters and pandemics? We
Doctora
start,
Jiménez.
Dr. Jimenez.
Mira, yo creo que la prioridad
I think that the priority
que nos demanda la pandemia
that the pandemic
y una vez que
demanding from
logró
us,
revelar lo que sabíamos,
and once it has
porque
shown
nuestros sistemas
to
sanitarios
reveal
eran
what we already knew
insuficientes,
because our
no por
health
la
systems
pandemia, sino
were
por la
insufficient, not with the
actividad
pandemic,
mantenida
it was
por muchas décadas.
before
Y, y
for
la
many
pandemia lo
decades,
que ha hecho es poner al
and
desnudo
the
esa
pandemic just
situación en
showed
donde
that
todos los
situation.
países, unos
All
más,
the
otros
countries,
menos, pero se
one more than
enfrentaron a
others, one less than
déficits
others,
de
but they
recursos
face
humanos,
deficits in
de
human resource, in
capacidad
hospital beds,
UCI, de
in
ventiladores, de
ICU beds,
oxígeno,
ventilators,
de
oxygen,
medicamentos, de
drugs,
capacidad de producción de equipos de protección personal,
PPE
de
production,
productos biológicos.
or
Entonces,
biological project
eso la
production were
pandemia lo puso al
decreased.
descubierto
The
y
pandemic
sí
showed
estábamos
all these
con esa
limitations, and
insuficiencia
this is
primera
how we start with that insufficiency that goes against rights and is being accepted as natural. And we, in orders, we always say, and it's repeated by our executive secretary, with budget, there's no rights. And the priority for us is not to lose terrain in what we've made progress, but for the first time in history, health has been placed in the same debate level as other priorities that traditionally considered by countries like foreign relations or economy. And we cannot lose that position. Our priority is to continue pending the need that health is seen as a sector that generates development. Health is not just an expenditure portfolio, it's a sector that can contribute and contributes to the economic development of a country, and that needs to be built in order to respond to the needs of the people. The health need of the people has been systematically put aside. That should be our mission for the construction of the health system. Pandemic left us worse than we were before, and pandemic is generate an increase in the demand of care for health because of the sequelae from the pandemic and for all the things that was ignored during the pandemic. So we need another health system that gives response to the needs, and the first step will be to dimension those needs, know what's going on with the needs of the people, and to project that horizon of that we need to reach and how far we are to get there. And the ORAS is moving in that sense through the Andean Roundtable of Fight Against Inequalities in Health. We're doing that collection of indicators that inform about the needs of health in the Andean population, and the Andean Health and Economic Committee is trying to obtain the support of the evidence that we were able to give response to the health needs of the population. Thank you, Lucho. Now, with regards to the question, the Pan American Health Organization, the World Health Organization, had established that in order to have a health system that responds to the needs in the modern world, we need a 9% of GDP. If we analyze the income by this GDP or the inputs, we don't reach that, most of the cases, 1/3 of this proportion. So if we don't have that amount, we are administering poverty, we are administering sufficient resources that cannot provide support to training, equipment replacement, interaction with communities or with other professionals, and have this health more accessible to the population. We don't have that, and that definitely needs to change. If we don't change that and priority other topics, what's the point in having wealth? What is the point in having a very small group with access to wealth and a large group with a lot of poverty? At the end of the pandemic has shown us that the system doesn't make sense. The one that's been developing, there needs to be a substantial change in the distribution. That is something that I consider of vital importance. The other aspect is that health is not offered by the Ministry of Health or the health staff. Health may be offered by a professor that is adequately trained, aware, and sensible, that have more access to a population that is still not ill, but that could, through his teachings and learning and training, can prevent this process by a quick identification. In the health sector, can do an early action following the professor's knowledge or the teacher. Not only the owner of a workshop or a factory, but finding a worker who's coughing constantly or that presents a respiratory symptoms needs to get quick care and they're not going to transmit it to other workers. Health needs to be shared by everyone. It's horizontal. We, from the institutional part, we will advocate to strengthen the interaction with other institutions that work with the health, to strengthen the actions with the ministries of health, but there needs to be a larger scenario where there is a commitment, and precisely Maria Carmen can give a more approximate information about the progress made in that regard. And with regards to the systems, that there's a need to promote through strategic planning. For 2030, we are preparing a reformulation following these circumstances of how health should be and what strategic lines we need to strengthen more. This action, the education action is so potent as well as the intervention, and much more when we have access to knowledge of health that is a right. When a mother can have the possibility to provide a better food to their child due to knowledge of what are the most important foods that are going to benefit the child and detect soon whenever he or she gets ill, these changes need to be done together. With regard to the allocation of funds, it is very important. We need to be located in the current context. To say that the state or the government needs to allocate that 9% of GDP, we're going to fall in the same story as it's not going to be able to do it because they have very other things to deal with. So we need to be creative and to add other instances to provide a health that is equitative, not exclusive, a health that allow everyone to have the possibility that by having new concepts of comprehensive work and participative efforts, we can have health for everyone. And there are procedures in countries that made progress in this regard. And there are many scenarios where we have been able to achieve more equity. The only thing that we need is education, more knowledge, more professionals, and that these critical spaces are covered by qualified professionals to provide a Thank you very much. Thank you for your response, and we thank for all the questions sent by the audience. And to close this space, I will ask you to, in 1 minute, leave us a final message.
Bueno, pues en un minuto.
Well, in 1 minute,
Circunscrito al tema que tuve que abordar.
with regards to the topic I presented, I leave that message of the human behavior and the relationship that we establish with nature. That is going to depend on, that's going to generate what situations of health we face. We need to always consider this of the potential of the emergence of new pandemics for to provide sufficient response to the health needs and well-being need of people. So everything that results will depend of our actions. And therefore it is through our actions and the definition of policies aimed to defend the right to well-being and health, it are going to be able to change the situation of health that we are facing and our relationship with the planet.
Considero que
I
es
consider
fundamental
that a
seguir
fundamental element to
enfrentando este y otros
continue
problemas
facing
que
this and
son
other health
relevantes
issues
como el que
that are
mencioné
so
también.
relevant like the one
Es
we just had.
necesario tener equidad,
There is a need to
es
have
tener la
equity,
posibilidad de que
ability,
se pueda llegar a
and
resolver los problemas a
solve
través de un
the
esfuerzo
problems
conjunto.
through a joint.
Esto no es un trabajo de
This is
un
not
grupo de
a
profesionales,
work of a group of
es un
professionals.
grupo, es un trabajo
This is an effort
equilibrado, el
that
cual
has to be
para tener
balanced
acceso al conocimiento,
so
el
that we can have
conocimiento
access
debe
to
ser
knowledge.
para todos
Knowledge
y
should
tener
be
la
for everyone
posibilidad de que
and have the
no
possibility
se haga la diferencia
that
en la investigación.
there's no
Y esto es
in this
clave, esto es fundamental.
this
Esto en
is
el caso del organismo se promueve intensamente
important, and this is
desde el
something
inicio
promoted by our institutions
con los
from the
webinares
start with
en
the
momentos muy
webinars
críticos en que los medios de comunicación
in a critical time where
la
the
intervención
communication
era
media and the intervention
compleja, muy
was
compleja.
complex,
Pero
very
los
complex,
medios de comunicación
but
masivos
the
salieron
mass
para
communication media were
dar
useful
tranquilidad y también
to
acceso a la
provide
información.
calm
Es
and
un
access to
elemento
information.
fundamental.
This is a
Pero
fundamental element.
también
But
tiene que
also,
darse sostenibilidad
there
a
needs to
esto a
be
través de la
a
alocación
sustainability to the
correspondiente de
corresponding
fondos
allocation of funds
para que se pueda disponer de
so
un
that we can
sistema muy
a
eficiente y
very
para
efficient
considerarlo
system
también muy amigable.
that's
Muchísimas
comparable
gracias.
and friendly. Thank you so much.
Bueno, reitero una vez
Once
más el
again,
agradecimiento a nuestros
my
excelentes
thanks
ponentes,
to the
a todos
speakers,
los asistentes que nos
to all the
acompañan,
participants
al equipo
that
del Horas
are with
Bonus
us, to the
y
Horas
a todos
Conu
los que
team,
participan en esta
and to all
actividad
of those who participate in
que es
this
posible
activity, which
gracias al
has been possible
compromiso
thanks to
de
the
la integración
commitment
andina y
to Andean
latinoamericana.
and Latin American integration.
Finalmente cedo la palabra
I
a
give the
la
floor to Dr. America
quien
Mekaye,
integra el
Executive
organismo
Secretary of
andino de
Horas
salud,
Conu,
convenio Hipólito Unanue,
to
para el
close
cierre de este
this
webinar
webinar
en nombre del...
on behalf of
Adelante,
the
doctora.
Horas Conu.
Gracias,
Go ahead,
María.
Dr.
Mis
Calle.
palabras,
Thank you,
mis
Mari.
palabras
My first words
agradecimiento
are
a
to
Patti,
thank
Lucho, de
Patty
verdad que a todo el
Lucho
grupo.
and to
Ha
the
sido
entire group.
un
It's
webinar
been
muy
a
interesante,
very
hemos tenido
interesting
bastante
webinar. We had
información,
a lot of
pero también hemos
information,
tenido
but
bastante
also had
posicionamiento
a
de lo
lot
que
of
realmente hacemos
positioning
como
with what
institución.
we do as an institution.
Nosotros tenemos
We
dos
have
pilares
two
fundamentales, el derecho a la
fundamental
salud
pillars, the
y la
right to
eliminación de
health
las
and the
desigualdades.
decrease of
Yo creo
inequality.
que en eso se basa
I
todo
think
nuestro
that that's
trabajo
where all our
y
work is
estamos seguros
based,
que lo estamos
and we are
seguros que lo
sure
estamos
that
haciendo.
we are doing
Ahora,
it
para
that
tener
way.
salud,
Now, to
primero que
have
todo, tiene
health,
que
first
ir
of
en el
all,
centro,
it
la
has to be in
población.
the
Tiene
center.
que ser
Health has to be
comprendida
in
por
the core,
todos,
and it needs to be
sobre todo
understood
no
by
solamente
everyone.
estoy hablando
And I
de
say not by all,
individuales, estoy hablando de
just
familias,
authorities. Let's talk about
¿no?
families.
Para que la salud siga siendo el
So health
centro,
is still the
es
center
indispensable
and
que
is an
avancemos.
indispensable health for
Hoy
development.
hemos hablado de
Today
COVID,
we've spoken
cómo
about
estamos,
COVID,
cómo están las
how we are
vacunas.
doing, the
Es una
vaccines,
necesidad imperiosa de que
that
todos
need that
contribuyamos
we all
a la
contribute
finalización de la pandemia.
to
Y han
finish
sido
this
muy
pandemic,
claros en
and they've
decirnos
been
que
very clear
requerimos
in
el tema de
telling
las
us
vacunas.
not only the
También hay
vaccines, but
medidas
also
farmacológicas
non-pharmacological measures that are still
lo que no
important.
quiero que se
And what I
olvide
don't want
es que
you to forget
lo que nos
is
exige la Organización
what
Mundial de
the
Salud es justo, ¿no?
WHO
Uno,
is
la
asking from us
respuesta
is
epidemiológica.
first epidemiological
Eso
surveillance,
comienza
but
cuando
that
uno
starts
hace
when
conciencia de que está
you
una
do
enfermedad
aware that you have a
epidémica.
disease
¿Y eso
and
qué
you
significa? Que el que tiene moco
may
tiene que
transmit.
aislarse.
So if you have symptoms, you need to isolate.
Entonces, otro tema es que hayan las pruebas
Another
moleculares. Esta ha
topic is
sido
to
una
have the
cadena.
molecular.
Hay varias maneras de
There are several
obtenerlas,
ways to
pero lo más
obtain them,
importante es que el
but the most
caso que
important
tiene
is
estos síntomas
case
o
that these symptoms
cualquier
has
infección viral
any
simple y
viral
sencillamente debe aislarse.
should be
Por eso es
isolated.
un tema que
I
no
think
hay
that's something
discusión.
that there is no
El tema de las
discussion.
vacunas. Ya han
Another major
hablado
issue is
nuestros
the
datos,
vaccines.
cómo han ido
You
variando
told
nuestras
us how the
posibilidades de tener
lineages
cobertura
and
de
the strains have
contaminación
changed and the need
de diferentes
to
vacunas.
have
Pero también
different
han sido
vaccines,
muy
but
claros
it's
en el
also very
sentido de que
clear
tenemos
in
que
the
cumplir
sense
con la
that we
vacunación.
need
No
to
todos han
complete the
cumplido,
vaccination.
no ha completado toda la
Most of you have
población,
not
pero
completed their
hay un
vaccination
tiempo de
schedule.
tiempo.
Not
Y
most of
tenemos
you,
que
right?
también
But
pensar
we need to think
en las
in
poblaciones de mayor riesgo.
the
Ya
population at
hace
highest
rato
risk.
estamos
And
hablando
here we're
del
talking about
personal de salud que está en la primera línea,
health personnel, those over the age of 60, and people with immunosuppression. The third topic is a clinical presentation. We know that we need to recognize it, identify without what point this condition or this patient needs to go to a hospital service, go to intensive care, but we also know that there are antivirals. So that is also important to guarantee that those antivirals are available for everyone who needs it at the time they need it. And the fourth topic that I consider important is communication. I always tell my team, we communicate what has evidence because we are a health institution. I cannot communicate anything based on my personal experience. I have to tell something that is based on studies, on research. And that is one of the things that the Animal Health Organization does most. We have many studies on cancer, of overweight and obesity, many studies that tells us how is the situation in our six countries. I think that we are making a good start of the year. We're webinar number 156, the first of 2023. I think that the questions have not been all responded, Marisela, because I see that there's a lot of questions, but unfortunately, our speakers have exceeded all the minutes that were allocated. But I think that's been worthwhile because we learned about many interesting things. We just like to close by saying that we cannot stop having health in the center of policy. And this is my pledge, not only to the national government at this moment. We have new authorities at the regional level and local level. And recently we need to prepare a text for the Roundtable Against Poverty, and we saw that it was clear what government needs to do in terms of health. Everything is written. What we need to do is do it. So those at the regional level and local level need to participate in the health. The second important topic is with no budget, without budget, there's no right. What is not allocated, which is not has budget allocation, cannot be done, cannot be implemented. We can be magicians like we did before with goodwill, we did a lot of things. That's no longer the case. In order for measures to be sustainable, they need to be added to the local, regional, and national budgets. And finally, and we need accountability. We all need to be accountable. Those of us who work in international organizations, those who work in the state, those in the local governments, to be, and the only way to accountability to have. We always insist, we cannot measure what is not defined. We cannot evaluate what is not measured, and you cannot improve what is not evaluated. I love it when they say, yes, we're starting again to do the 2020 plan. And what about the previous plan? What happened? The idea of what worked and what didn't work. And that's something that's very important. The basic principles that should rule are equity, solidarity, honesty. Yes, in our daily work. I always argue that rights and responsibilities, fine, responsibilities, if the rules of the game are the same. I cannot demand hand washing 3 times a day if they don't have water. Am I right or not? Not demand if the basic things that have not been solved yet. So with a lot of enthusiasm, we start 2023 and these webinars. We're sure that we're going to continue with you. We thank you for your massive participation. I thought that because it was the first of the year, we're not going to have a lot of people, but there are people from almost 12, 14 countries. And what I like more with Yadira is not only health, we have engineers, lawyers, anthropologists, sociologists. That is the idea. Health is not depending from the health sector only. Health depends on everyone. And let's do our job. But let's do our part of a job that we need to do. Always giving priority to the population with small vulnerability, boys, girls, adolescents, elderly, migrants, people with disability, people from indigenous populations. There are many ways to help. But once again, our governments have a responsibility in the three levels: local level, regional level, and national level. It doesn't matter what is the name in each country, because in the country we have different names for these territorial units. If the one in charge of his area, of his territorial unit, puts health where it should be, where it should be placed, things will definitely become better. Share with you that yesterday I was talking about this topic. In the morning, we were at the Foreign Relations Office and the representative from the countries, because health should not be removed from the center of our decisions. Definitely. When we said Happy New Year, let's not talk about love or work. Let's talk about New Year with health. Thank you very much. Next Thursday, we'll meet at 11. We're going to talk about depression, but we're going to give it a different approach. So see you next Thursday. Thank you very much.